Marcus Wells, board-certified physician helping Americans 60+ protect their health and live fully. If you're over 60, chances are your doctor has recommended routine blood work, whether it's to monitor cholesterol, blood sugar, kidney function, or hormone levels. And while many people assume a blood test is a simple process, just head to the lab, roll up your sleeve, and check it off your list, the reality is a bit more complex. What most people don't realize, especially those in their 60s and beyond, is that what you do before your blood test can significantly affect the result. That cup of coffee in the morning, it could raise your blood sugar. Skipping your regular blood pressure pill, that might throw off your cardiovascular readings. Taking your usual supplements, some of them can actually interfere with hormone or thyroid test results without you even realizing it. And when you're in your 60s, you don't want false readings leading to unnecessary stress, extra trips to the doctor, or even the wrong diagnosis. I've seen it happen far too often. Patients end up with abnormal lab values, only to find out later that their preparation was the problem, not their health. As a physician with over 25 years of experience, much of it working directly with older adults, I've walked thousands of Americans through the process of getting accurate and reliable lab work. And one thing is clear, being prepared makes all the difference. That's why in this article, I'm sharing the 10 most common, and most avoidable, mistakes people make before blood tests, especially those over the age of 60. These mistakes may seem small, but they can lead to delayed or incorrect diagnosis, repeat lab visits and additional costs, unnecessary medications or procedures, emotional stress and confusion for you and your family. The good news: every one of these issues can be prevented with the right information. Whether you're getting blood work for your annual physical, managing a chronic condition like diabetes or high blood pressure, or tracking the effects of a new medication, this guide will help you take control of your results and work smarter with your doctor, not harder. You've worked hard to get where you are in life. Don't let a simple oversight before your blood draw derail your care. Let's walk through each mistake together so you can feel confident, informed, and ready when it's time for your next lab appointment. Let's get started. Not fasting properly, and it's more than just no food. For many adults over 60, routine blood work becomes a regular part of managing health. Whether it's monitoring cholesterol, blood sugar, or kidney function, your doctor may ask you to fast before your test. But here's where many people, especially older adults, make a critical error. They misunderstand what fasting really means. Fasting isn't just about skipping breakfast or avoiding solid foods. In medical terms, fasting means you should consume nothing except plain, unflavored water for a specific number of hours, usually between 8 to 12, before your blood draw. That includes avoiding coffee, even black tea, including herbal and green, fruit juice or flavored water, milk or cream, even a splash, artificial sweeteners, chewing gum or mints. For those in their 60s and older, these small exceptions may seem harmless, but they're not. Even a tiny amount of flavor, sugar, or calories can alter your blood test results significantly. For example, drinking coffee with cream can cause a spike in blood glucose, insulin, and triglycerides, 3 key markers we use to screen for metabolic issues like prediabetes, type 2 diabetes, and high cholesterol. I'll never forget a patient in his late 60s who came in for a routine fasting blood test. He told me confidently that he hadn't eaten anything in 12 hours, but when I probed a little further, he casually mentioned drinking his usual morning cup of coffee, with just a touch of cream. His results showed elevated blood sugar, and we nearly diagnosed him with diabetes. In reality, it was the cream in the coffee that caused the spike, not a chronic condition. These kinds of misunderstandings are more common than you'd think, especially among older adults who've been having blood work for decades but were never clearly told what fasting truly involves. Misinterpreting the results can lead to unnecessary repeat testing, anxiety, and in some cases, the wrong treatment plan. If your doctor orders a test that requires fasting, especially lipid panels or advanced cholesterol profiles, a full 12-hour fast is often necessary. That means if your appointment is at 9 a.m., your last bite or sip, besides water, should be no later than 9 p.m. the night before. For older Americans, especially those managing multiple chronic conditions, clear communication is key. Always ask your healthcare provider these 3 questions before a fasting blood test. How many hours should I fast? Is water allowed? Should I continue taking my morning medication? Don't assume. Ask. The more precise you are with your preparation, the more accurate and useful your results will be, saving you time, worry, and potential complication. In your 60s and beyond, your health decisions carry even more weight. Getting your blood work done right the first time ensures your doctor has the right data to support you, not mislead you. It's a small but powerful step toward better, safer care. Fasting too long or skipping, a hidden risk for adults over 60. While most people understand they need to fast before certain blood tests, many take this instruction to the extreme, especially older adults who are trying to be cautious. I've had countless patients over 60 who thought, if 8 hours is good, 16 hours must be even better, or who skipped all their medications to avoid interfering with lab results. But here's the truth. Overfasting or skipping your regular medications can be dangerous, particularly as we age. Let's break it down. Overfasting isn't safer, it can be harmful. As we get older, our bodies don't regulate blood sugar as efficiently as they used to. For people with diabetes, especially those taking medications like glipizide, glyburide, or insulin, fasting longer than prescribed can cause hypoglycemia, or dangerously low blood sugar. This isn't just about feeling a little shaky. In adults over 60, hypoglycemia can result dizziness or confusion, loss of coordination, fainting or falling, which increases fracture risk, emergency hospitalization. Even if you're not diabetic, extended fasting can still affect your energy, balance, and cognitive sharpness, especially if you're taking multiple medications or dealing with age-related changes in metabolism. Skipping medications, just in case, can be even riskier. Some people worry that medications like blood pressure pills will skew test results, so they stop them without checking with their doctor. That decision can backfire quickly. Missing even one dose can cause your blood pressure to spike, putting you at risk for a heart attack or stroke. Seizure medications, suddenly stopping these, even for one morning, can increase your chances of having a seizure, especially if you've had one in the past. Thyroid medications, heart meds, or diuretics. Skipping these may not only impact your lab results but also destabilize your condition, particularly if you're being monitored for chronic disease. And let's not forget, Americans over 60 are often managing multiple chronic conditions at once. That means more medications, and more potential complications if you stop them abruptly. So, what should you do? The key is clarity, not guesswork. Before your scheduled blood test, talk with your doctor or pharmacist and ask these 3 questions. Do I need to fast for this test? If so, for how long? Should I take my morning medications as usual? Are there any medications or supplements I should skip temporarily? Your healthcare provider can tailor their advice based on health history, the medications you're on, the specific lab tests being performed. For example, if you're getting your blood sugar or lipid levels checked, you may need to fast, but should still take your blood pressure medication with a sip of water. In contrast, if you're having a thyroid panel done, fasting might not be necessary at all. Final thought. For older adults, especially those over 60, the goal is to prepare smart, not extreme. You don't need to overcompensate by fasting too long or stopping essential medication. In fact, doing so can put you at unnecessary risk. Always check with your healthcare provider in advance. A 5-minute phone call could prevent a fainting episode, a trip to the emergency room, or a misdiagnosis. Taking a cautious but informed approach ensures that your test results are accurate, and that your body stays safe in the process. Here's why it matters for adults over 60. Staying active is one of the best things you can do for your health, especially as you age. Regular physical activity supports heart health, bone density, mobility, mood, and energy levels well into your 60s and beyond. But when it comes to blood testing, timing your workouts matters more than you might think. Many older adults make the well-intentioned mistake of hitting the gym or going for a vigorous walk the morning of their blood draw, believing that exercise will only reflect positively on their health. Unfortunately, this can lead to misleading lab results, even if you feel perfectly fine. Let's break down why intense exercise right before a blood test can create problems. Temporary changes that skew your result. When you engage in high-intensity activities, such as weightlifting, resistance training, long-distance walking, or cycling, your body undergoes physiological changes that are completely normal. However, these changes can be misinterpreted when looking at blood work. Here are some of the key markers of creatine kinase. After strenuous exercise, your muscles release an enzyme called CK into your bloodstream. Elevated CK levels can resemble the pattern seen in actual muscle damage or inflammation, which may alarm your doctor unnecessarily. Creatinine. This waste product is filtered by your kidneys. After a workout, your creatinine levels may rise due to muscle breakdown, making it appear as though your kidneys aren't functioning as well as they actually are, especially concerning for those over 60, as kidney health is closely monitored in older adults. Liver enzymes. Physical exertion can also cause a spike in liver enzymes like AST and ALT. If these appear elevated, your doctor may suspect liver issues, prompting additional tests or even referrals to specialists. Blood glucose. Exercise increases the body's energy demands, which can temporarily elevate blood sugar levels. This can confuse your doctor if they're monitoring your glucose for prediabetes, diabetes, or insulin resistance, all of which are more common in people over 60. Why this is especially important for seniors. As we age, our bodies become more sensitive to metabolic shifts. Healthcare providers are often watching lab results more closely for signs of chronic conditions like diabetes, heart disease, kidney disease, and liver issues. Even a temporary change caused by exercise can raise unnecessary red flags, leading to repeat tests, anxiety, and potentially costly medical evaluations that could have been avoided. In fact, one of the most common reasons patients over 60 are asked to return for retesting is due to test results that were skewed by something they did, like working out, just hours before the blood draw. What you should do instead. To ensure your blood test results reflect your true baseline health, here's what I recommend. Avoid intense exercise for at least 24 hours before your blood test. This includes any activity that raises your heart rate significantly, causes muscle soreness, or involves weight resistance. Stick to light activity. If you need to move around or stretch, that's fine, just avoid anything that feels like a workout. Give your body time to rest. A day of recovery before your labs not only supports accurate readings but is also a healthy part of any fitness routine, especially for those over 60. Bottom line. While exercise is a powerful tool for aging well, timing is everything when you're getting your blood drawn. Let your body settle and recover before heading to the lab. It's one of the simplest ways to avoid confusion, retesting, and unnecessary concern, giving both you and your doctor the clearest possible picture of your health. Marcus Wells, board-certified physician helping Americans over 60 thrive. Not drinking enough water, a common yet costly oversight for adults over 60. As we get older, our bodies naturally undergo changes that can affect everything from metabolism to thirst perception. Many adults over 60 simply don't feel thirsty the way they used to, and that can become a real issue when it comes to preparing for blood work. Dehydration is one of the most common, and most overlooked, reasons for inaccurate or difficult lab results. And here's why it matters. Dehydration makes blood draws more difficult, especially for aging veins. If you're not well hydrated, your blood volume decreases slightly and your veins become less plump. This makes it significantly harder for the phlebotomist to locate a good vein, especially in older adults, whose skin may already be thinner and whose veins may be less elastic. Result: more pokes, more time in the chair, and often, more discomfort. Concentrated blood can distort key lab values. When you're dehydrated, your blood becomes more concentrated. That means the levels of substances in your blood, like creatinine, sodium, potassium, and urea nitrogen, may appear artificially elevated. For someone in their 60s or 70s, this can be especially misleading, as physicians may interpret these numbers as early signs of kidney dysfunction or electrolyte imbalance. That could trigger unnecessary follow-up tests, cause concern about conditions that aren't actually present, or even result in inappropriate medication adjustments. Hydration directly affects kidney function result. The kidneys are responsible for filtering waste and maintaining fluid and electrolyte balance in the body. When you're dehydrated, your kidneys have less fluid to work with, which can lead to a temporary dip in performance on your lab report. For seniors, where even slight changes in kidney function are monitored closely, this can raise false alarms. I've seen patients over 60 sent for additional nephrology consults or imaging studies based solely on labs that were skewed by nothing more than a lack of water intake. Aging decreases natural thirst, so you may not realize you're dehydrated. One important factor many people in their 60s and beyond don't realize is that the sensation of thirst becomes less reliable with age. You may not feel thirsty even when your body needs fluids. That's why it's important to make hydration a conscious habit, especially the day before and morning of your blood test. So, what should you do? Start hydrating the day before. Don't wait until the morning of your blood draw to start drinking water. Begin sipping water steadily throughout the previous day. Aim for around 6 to 8 cups unless your doctor has placed you on a fluid restriction. Drink a full glass of water 1 to 2 hours before your test. Even if you've been instructed to fast, water is usually allowed, and highly recommended. Only in very rare cases, such as before sedation or certain specialized tests, is water restricted. Double check with your doctor if you're unsure. If you've been told to fast, and you're not sure whether that includes water, call your doctor or the lab in advance. But for most standard blood tests, including cholesterol, glucose, kidney panels, and complete blood counts, water is not just allowed, it's encouraged. Final thoughts for adults 60 plus. In my experience as a physician caring for Americans over 60, hydration is one of the simplest ways to make your blood test more comfortable and more accurate. It's also one of the most overlooked. By staying properly hydrated before your blood work, you make the process easier for you and your care team. Improve the reliability of your test result. Reduce the chances of repeat testing or misinterpretation. It may seem like a small step, but for older adults, it's a powerful one. So next time you have a lab appointment, don't just fast. Hydrate smartly. Your body, and your doctor, will thank you. Avoid blood tests right after drinking alcohol or while you're sick. As someone over 60, you know how much your body changes with age. And that includes how your body processes things like alcohol and medication. That's why it's so important to time your blood tests wisely, because lab results are only helpful when they reflect your true, everyday state of health, not a temporary fluctuation. Why alcohol can mislead your lab result. Let's say you've just returned from a trip, maybe a long weekend with friends, a cruise, or a family celebration. You enjoyed a few drinks, maybe more than usual. That's completely normal and understandable. But, even a couple of nights of heavier than usual drinking can alter key lab markers for up to several days. Alcohol can falsely elevate liver enzymes. These are markers we use to assess liver function. Alcohol, especially in larger amounts, can temporarily cause them to spike, sometimes to levels that mimic liver damage. These blood fats can shoot up dramatically after drinking alcohol. This is especially important if your doctor is evaluating your heart disease risk or trying to manage your cholesterol. Blood sugar. Glucose. Alcohol can cause erratic blood sugar levels. It may raise your fasting glucose or even interfere with long-term markers like HbA1c in some cases. If you're not a regular drinker but just had a few drinks more than usual, these temporary shifts can be misleading. Your doctor might think something is seriously wrong, when in reality, your body is simply reacting to alcohol. For someone in their 60s, this matters even more. Liver function tends to slow with age, and older adults are more sensitive to the effects of alcohol. What you could handle at 40 might now cause more disruption than you expect. Illness can also throw off results. Consider you're recovering from a seasonal cold or a mild bout of bronchitis. You've been on antibiotics or over-the-counter medications, and you're not quite back to your normal routine. Maybe you haven't been eating well, your sleep is off, and your activity level has dropped. These factors, along with certain medications, can also cause changes in your lab result. Liver enzymes might rise due to medication metabolism. Kidney function might appear worse than it is due to dehydration. Inflammatory markers might be higher than usual as your immune system works to fight off illness. If you get your labs drawn during this period, your doctor might see values that don't reflect your normal health status and recommend unnecessary follow-up testing, or worse, adjust medications based on skewed results. What should you do instead? If your lab work isn't urgently needed, it's often best to wait until you've returned to your baseline, meaning you've had at least a few days of no alcohol. Full recovery from illness. A return to your usual eating, sleeping, and hydration habits. Of course, there are exceptions. If your doctor specifically ordered labs to evaluate how your body is responding to a medication, such as liver function tests while on statins or antifungal treatment, then the timing may be intentional. In those cases, follow your doctor's advice closely, but for routine blood panels, like cholesterol checks, liver enzymes, or blood sugar levels, timing is everything. A note for Americans 60 and older. As we age, our bodies take longer to bounce back. A weekend of indulgence or a week of illness can have a stronger and longer-lasting effect on our metabolism, our immune system, and our lab values. For that reason, older adults should be especially cautious about when to schedule routine blood work. The goal is to avoid false positives, unnecessary worry, repeat visits, and even inappropriate treatments. One of the best ways to do that is simply by giving your body time to reset before testing. Taking supplements that interfere with lab results, a hidden risk for older adults. If you're over 60 and working hard to maintain your health, chances are you're taking a few supplements, maybe even more than a few. But what most people don't realize, especially in their 60s and beyond, is that some of the most popular over-the-counter supplements can interfere with your blood test results, leading to confusion, unnecessary follow-ups, and even incorrect treatment adjustments. One of the most common culprits, biotin, also known as vitamin B7. Biotin is widely marketed for improving the health of your hair, skin, and nails, and it's found in countless supplements on pharmacy shelves across the US. It's especially popular among older adults looking to slow age-related changes in skin elasticity, nail brittleness, and thinning hair. But here's what you need to know. Biotin can interfere with certain blood tests, especially those related to your thyroid. Biotin itself isn't harmful. It doesn't damage your thyroid or your organs. But it interferes with the way laboratories measure key hormones, particularly TSH, the hormone your brain sends to your thyroid to regulate how fast your body burns energy. If you're taking biotin close to the time of your blood test, it can cause the lab equipment to underestimate your TSH levels. That means your test might show your thyroid is overactive, even if it's perfectly normal. For Americans in their 60s, this is especially important because many adults over 60 are being monitored for thyroid disease, which becomes more common with age. Misreading could prompt your doctor to lower your thyroid medication, even when it's not needed. Some people are wrongly referred to endocrinologists or ordered additional expensive testing, all because of inaccurate lab results caused by a supplement. Real-life example from my practice. I once saw a 62-year-old patient who had been feeling more tired than usual. Her labs came back showing low TSH, which typically signals an overactive thyroid. But when I asked about her medications and supplements, she casually mentioned she was taking a beauty blend that included 5,000 micrograms of biotin daily. We paused the supplement for several days, retested her labs, and, sure enough, her TSH was perfectly normal. No thyroid problem, no need for new medication, no need for an unnecessary referral. How to protect yourself. If you're taking any supplement that contains biotin, and this includes many popular anti-aging blends, multivitamins, and skin nail formulas, you need to stop taking it at least 2 to 3 days before your blood test. In some cases, especially with higher doses, your doctor may advise you to stop even earlier. Also, be sure to always tell your healthcare provider that you're taking biotin. This simple step can prevent misdiagnosis and save you time, stress, and money. Final thought for adults 60 and older. Many older adults are doing the right thing by investing in supplements to support aging gracefully. But unless you're aware of how those supplements can affect your lab work, you might unknowingly complicate your care. So if you're over 60 and getting ready for a routine blood panel, especially one that includes thyroid function tests, take a moment to review your supplements. Check for biotin, stop it in time, and inform your doctor. It's a small step that can make a big difference in ensuring your health decisions are based on accurate information, not distorted data. But what many people don't realize is that when you get those hormone tests matters just as much as what you're testing. Hormones don't stay the same throughout the day, they follow natural daily rhythms, and ignoring that timing can lead to false results, wrong diagnoses, or unnecessary treatments. Let's break it down. Testosterone, morning matters, especially for men over 60. For men, testosterone levels are usually highest in the early morning, typically between 7 a.m. and 10 a.m. After that, levels drop gradually throughout the day. If you're a man in your 60s or older and your testosterone is tested in the afternoon, you may see an artificially low number, even if your body is producing enough testosterone for your age group. That can lead to a diagnosis of low T when you may not truly have it, which in turn could lead to unnecessary treatments, including testosterone replacement therapy. Why does this matter? Testosterone therapy can have side effects, including increased red blood cell count, fluid retention, and risk of prostate enlargement. Many men are prescribed testosterone based on a single test done at the wrong time of day. Always schedule testosterone testing in the early morning, ideally before 10 a.m., and make sure you've had a good night's sleep. Your levels should be tested more than once before making any decisions about treatment. Cortisol, one hormone, two different testing goals. Cortisol, your primary stress hormone, is another hormone that fluctuates on a daily cycle. Its levels are highest in the morning and lowest around midnight, in people with a healthy circadian rhythm. But how we interpret cortisol results depends on what we're looking for. If we're testing for cortisol deficiency, for example, if your doctor suspects Addison's disease, then we want to test your cortisol early in the morning, usually around 8 a.m. If your levels are low when they should be high, that's a red flag. If we're testing for cortisol excess, like in Cushing's syndrome, we want to test when cortisol is supposed to be at its lowest, at night. That's why a common test is the midnight salivary cortisol test, where you collect a saliva sample at home and mail it to the lab. Why sleep and routine matter. Here's something many older adults overlook. Your sleep habits directly influence hormone levels. If you were awake all night due to travel, shift work, insomnia, or stress, and then go for blood work at 8 a.m., your results might not be accurate. That's because sleep deprivation disrupts your body's internal clock, affecting cortisol and testosterone levels. The lab compares your results to standard ranges based on people who slept through the night. If you didn't, your levels may look off even when nothing is truly wrong. So, if you're planning to have hormone testing done, make sure you're well rested. Stick to your normal routine the night before. Let your doctor know if you had a poor night's sleep, traveled across time zones, or had unusual stress. For women over 60, timing can still play a role. Although postmenopausal women don't have the same monthly hormone fluctuations they did in earlier years, cortisol and thyroid hormones still follow a daily pattern. Poor sleep, illness, or testing at the wrong time can still interfere with accurate results and may influence decisions about thyroid management or adrenal support. Final takeaway. If you're in your 60s or beyond, getting your hormone levels tested at the right time of day is critical for getting the right answers, and avoiding the wrong ones. Whether you're checking testosterone, cortisol, or other hormones, proper timing and sleep hygiene can help your doctor make informed decisions that truly reflect your health. Talk to your doctor before scheduling labs. What time of day should I get this test? Should I fast or not? Does sleep affect this test? Taking these small steps can mean the difference between an accurate diagnosis and months of chasing the wrong problem. Not telling your doctor about all medications and supplements. At your age, even small omissions can lead to big misunderstandings. Marcus Wells. If you're in your 60s or beyond, you've probably accumulated a long list of medications, vitamins, and supplements over the years. Maybe you're on a blood pressure pill prescribed a decade ago, a daily multivitamin, and recently started a supplement for joint support that your neighbor swears by. Or perhaps you joined a men's health clinic that prescribed testosterone injections or pellets to boost your energy. If your doctor doesn't know exactly what you're taking, they're working in the dark, and that can lead to serious consequences. Let me tell you about a patient I once saw. He was a 63-year-old man, active, healthy-looking, but his routine labs showed an unusually high red blood cell count. His primary care physician was worried. High red cells can be a red flag for rare and serious conditions like polycythemia vera, a bone marrow disorder. The doctor was preparing to refer him to a hematologist for a full workup. But when I sat down with him and asked a few extra questions, it came out that he had recently started receiving testosterone pellet therapy at a men's clinic. He didn't think it was important to mention. After all, it wasn't a prescription from his regular doctor. That missing piece changed everything. Testosterone therapy is a known cause of elevated red blood cell counts. It's not dangerous in itself when properly monitored, but if a doctor doesn't know you're taking it, they may misinterpret your labs, assume something seriously wrong, and send you down a path of anxiety, referrals, and expensive testing you didn't need. This issue is even more common now with the growth of telehealth services, online prescription programs, over-the-counter and herbal supplements, weight loss clinics, anti-aging and hormone therapy centers. Many of these services don't coordinate with your primary care doctor. And unless you tell your physician what you're using, it doesn't get documented in your medical record. Why it matters more after 60. As we age, our bodies metabolize medications differently. What was once a harmless supplement at 40 can start interacting with your heart meds or affect your liver enzymes at 65. Even something as natural as turmeric, fish oil, or magnesium can interfere with blood clotting, kidney labs, or thyroid testing. Doctors depend on a complete picture to interpret your test results accurately. That includes prescription medication, vitamins and minerals, herbal or natural remedies, hormonal therapies, like testosterone, thyroid extracts, injections, drops, pellets, creams, or patches. Everything counts. And if you're not sure whether something matters, tell your doctor anyway. Let them decide. It's far better to overshare than to leave out something that could change the course of your care. What you can do today. Bring a full list to your appointments, include brand names, doses, and how often you take each item. If you use a pill organizer, snap a picture and show your doctor. If you started anything new from a clinic, over-the-counter store, or online pharmacy, let your doctor know. Be honest. You're not being judged, you're being protected. Being transparent with your care team isn't just about doing the right thing, it's about making sure your test results are read in context. Especially after 60, when you may be managing more than one condition at a time, the clarity you provide can be the difference between accurate care and unnecessary intervention. Better communication leads to better decisions and better health. 9. Getting blood work too soon after changing medication. Why timing matters, especially after 60. If you're over 60 and managing chronic conditions like hypothyroidism, type 2 diabetes, or high blood pressure, chances are your doctor may occasionally adjust your medication. That could mean starting a new prescription or changing the dosage of something you've been taking for years. And while it's natural to want quick answers, to see if the new medication is working or causing side effects, testing your blood too early after a change can give you a misleading picture. Medications need time to take effect. Many medications, especially those that regulate hormones or blood sugar, work gradually. For example, thyroid medications like levothyroxine may take several weeks to fully normalize your TSH levels. Diabetes medications such as metformin or GLP-1 agonists require at least a few weeks to show meaningful changes in your A1C or fasting glucose. Even cholesterol medications like statins may not show full lipid changes until you've been on them for a month or more. Your body, especially after 60, doesn't always respond overnight. Metabolism tends to slow down, and organs like the liver and kidneys, which process most medications, may take longer to adjust. So testing just a few days, or even a week, after starting or changing a medication may result in labs that don't reflect the full therapeutic effect. This can confuse your doctor and lead to unnecessary changes in treatment or even additional testing you don't need. Why this matters for seniors. At age 60 and beyond, many Americans are managing multiple medications at once. If your doctor orders blood work too soon after a change, it may look like the new dose isn't working, when in reality, your body simply needs more time to respond. In some cases, your doctor may even think the medication is causing an adverse effect when it's just part of the normal adjustment period. This is particularly true for medications that affect thyroid hormones, free T4, blood sugar control, fasting glucose, insulin, kidney function, cholesterol and triglycerides, blood pressure medication. For older adults, interpreting lab values too early can cause overcorrection, medication fatigue, and even distrust in treatment, none of which serve your long-term health. How long should you wait? Unless your doctor has a specific reason to test earlier, for example, to check for side effects or monitor kidney safety, the general rule is wait 4 to 6 weeks after starting or adjusting thyroid or cholesterol medication. Wait at least 2 to 4 weeks for diabetes medications, depending on the drug. For blood pressure changes, your doctor may recommend checking blood pressure at home rather than rushing back to the lab. Always follow the specific timeline your doctor recommends. If you're unsure, ask, when should I get my labs done to make sure the medication has had time to work? Final thought. For Americans over 60, managing your health takes patience, and that includes being patient with your medication. The best way to get accurate, actionable lab results is to give your body the time it needs to adapt. That way, your care team can make informed decisions based on true, stable numbers, not premature snapshots. Your time is valuable. Your health is too. So let's get it right the first time. It's common to think you can wait until the very last minute to get your blood drawn before your doctor's visit, or even worse, to cancel or postpone your appointment if all your lab results haven't come back yet. This approach may seem convenient or less stressful at first, but it can actually cause delays in your diagnosis and treatment, and in some cases, even put your health at risk. Here's why this is an important issue. Lab processing times vary. Depending on the type of tests ordered, some results may take only a day or two, while others, like specialized hormone panels or genetic tests, might take longer. If you wait until just before your appointment to do your blood work, there's a good chance your doctor won't have all the information available during your visit. Partial results are still useful. Even if some lab results are pending, the tests that have come back might reveal critical information. For example, your doctor could detect early signs of kidney problems, anemia, infections, or abnormal blood sugar levels. Acting on these findings promptly can prevent complications, hospitalizations, or worsening symptoms. Delaying care can lead to worse outcomes. For seniors, timely diagnosis and management of chronic conditions like diabetes, hypertension, or heart disease can be life-saving. Skipping or postponing appointments because of incomplete lab results can delay important interventions, medication adjustments, or referrals to specialists. Your appointment is about more than labs. A doctor's visit isn't just about reviewing blood work. It's also an opportunity to discuss symptoms, medication side effects, lifestyle changes, and any new health concerns. Even without full lab data, your healthcare provider can help guide your care based on the information available. Plan ahead and communicate. To avoid last-minute stress, schedule your blood draw several days before your appointment. If you know certain tests will take longer, ask your provider about the best timing for labs and visits. If some results aren't back by your appointment, don't cancel, attend and discuss the next steps, including when to follow up. For Americans over 60, maintaining proactive communication with your healthcare team is essential. Managing your health is a partnership, and timely lab testing combined with regular doctor visits helps ensure you stay on track. Remember, your health can't wait. Don't let timing issues interfere with the care you deserve. Show up for your appointments, review what's available, and work with your doctor to schedule any necessary follow-ups. For Americans entering their 60s and beyond, blood tests are far more than just routine lab work. They provide a vital snapshot of your overall health and can guide important decisions about your medical care. At this stage of life, staying proactive with your health is crucial, and getting accurate blood test results is one of the most straightforward, yet powerful tools you have to monitor how your body is doing. The way you prepare for your blood test has a direct impact on the accuracy of the results. Simple missteps, like eating or drinking something you shouldn't, skipping medications without medical advice, or not telling your doctor about all the supplements and treatments you're using, can lead to false readings. This can delay diagnoses, result in unnecessary follow-up tests, or even lead to treatments that you don't really need. By consciously avoiding the 10 common mistakes we've discussed, you're not only saving yourself the inconvenience and anxiety of repeating blood tests, but you're also ensuring that your healthcare providers get reliable information. This empowers your doctor to make the best possible decisions tailored to your unique health needs. Whether it's managing chronic conditions like diabetes and heart disease, checking hormone levels, or monitoring kidney and liver function, accurate labs are the foundation for effective care. For those over 60, your body goes through changes that can affect test results. Metabolism slows, hormone levels fluctuate, and the way medications interact can be different than when you were younger. This makes it all the more important to follow preparation guidelines precisely and communicate openly with your healthcare team. If you found these insights helpful, I encourage you to share them with your family members, friends, or caregivers. These are the people who might also benefit from knowing how to approach blood tests correctly. And don't hesitate to bring up any questions you have at your next doctor's appointment. Being informed and involved in your healthcare is one of the best steps you can take toward maintaining your independence and quality of life. Remember, knowledge is powerful, but it's most powerful when paired with action. Taking these small, thoughtful steps before your blood test can make a big difference in keeping you healthy, active, and confident as you enjoy your years ahead. Stay well, stay informed, and stay proactive. After 50, try doing this in the morning. You could live 30 more years. The Success Fuel. By Dr. Marcus Wells for Healthy After 50. What if I told you that the first 5 minutes after you wake up could decide whether you enjoy another 5, 10, even 30 healthy and independent years? And no, I'm not talking about miracle pills, expensive supplements, or secret anti-aging treatments. I'm talking about something much simpler, and much more powerful. A simple morning ritual. A routine backed by both ancient wisdom and modern science. A practice that can protect your heart, sharpen your mind, and keep your muscles and joints strong well into your 60s, 70s, and beyond. If you're waking up tired, stiff, or mentally foggy, consider this your wake-up call. But it's also your second chance. Because in just 5 minutes every morning, you can give your body and brain exactly what they need to age better, and feel better. Today on Healthy After 50, I'm going to walk you through 5 simple but powerful morning habits. Think of them as your daily armor against aging. I've used these exact steps with my patients for over 25 years, and I've seen them transform lives, especially for people in their 50s, 60s, and 70s. So let's get started. Why the first 5 minutes after waking are so important. Before we jump into the steps, let me explain why these first moments of your day matter so much. When you're young, you can roll out of bed and rush into the day without much thought. But after 50, your body changes. Overnight, while you sleep, your body loses water through breathing and perspiration, which makes your blood thicker. Your circulation slows, and your heart has to work harder to get oxygen to your brain and muscles. Your joints stiffen because the fluid that keeps them moving, the synovial fluid, becomes thicker when you're still for hours. Your muscles are in a fasted state, and if you don't feed them, your body begins breaking them down for energy. Your brain wakes up slower, leaving you mentally foggy and more prone to forgetfulness or imbalance. This is why many health problems happen in the morning: heart attacks, dizziness, even falls. But if you take just 5 intentional minutes when you first wake up, you can counter all of this. You can support your heart, protect your muscles, keep your joints healthy, and wake up your brain. Now let's break it down step by step. Step 1. Hydrate your heart before coffee. Most people over 50 start their mornings the wrong way. They stumble to the kitchen, pour a cup of coffee, and call it breakfast. But here's the problem. After sleeping for 6 to 8 hours, you're already dehydrated. Your blood is thicker, and your heart has to pump harder to circulate it. This is one reason heart attacks and strokes are more common in the early morning, especially for adults over 60. The solution is simple, and it can save your life. Before coffee, before food, drink 1 glass of room temperature water with the juice of a quarter lemon. Why room temperature? Because cold water can constrict your blood vessels, making circulation harder. Warm or room temperature water, on the other hand, helps your blood flow freely. Why lemon? Lemon adds potassium, vitamin C, and natural compounds that help your liver flush out toxins filtered during the night. It also wakes up your digestion and gives your metabolism a gentle nudge. This takes less than 30 seconds, but it could mean the difference between a sluggish morning and a vibrant, energized start to your day. Step 2. Wake up your circulation with gentle movement. After lying still for hours, your circulation slows, your joints stiffen, and your brain isn't getting enough oxygen. That's why you feel groggy, stiff, or even dizzy when you first stand up. Instead of forcing yourself into the day, you need to wake your body up gently. And it only takes 1 minute. Here's what I want you to do the moment you get out of bed. Stand with your feet shoulder-width apart. Take a deep breath in, raising your arms overhead. Exhale slowly as you lower them. Roll your shoulders backward 5 times, then forward 5 times. Gently rotate your neck in slow circles. Finish with 10 slow heel raises, lifting your heels off the floor, then lowering them. This simple sequence improves blood flow, sends oxygen to your brain, and increases balance and coordination. For my patients over 65, this 1 minute has been life-changing. Some of them tell me they feel less dizzy in the mornings, and several have even reduced their risk of falls. Step 3. Feed your muscles within 30 minutes. Now let's talk about something almost no one thinks about in the morning: muscle loss. After 50, especially after 65, your body naturally begins to lose muscle mass, a condition called sarcopenia. But here's what most people don't know: in the morning, if you don't eat protein, your body starts breaking down its own muscle tissue to use for energy. This is why so many older adults feel weaker year after year, even if they stay active. The good news? You can stop this process in its tracks by eating a little protein within 30 minutes of waking. It doesn't have to be a big breakfast. You just need 10 to 20 grams of clean protein. Some great options: a small protein shake or smoothie, 2 boiled eggs, a cup of Greek yogurt with a scoop of protein powder. Studies show that people over 60 who consistently eat protein in the morning lose up to 60% less muscle over 5 years compared to those who skip it. And maintaining muscle doesn't just keep you strong, it protects your balance, reduces your risk of falls, and even improves brain health. Step 4. Loosen your joints with 90 seconds of mobility work. If you've ever felt stiff or achy in the morning, you're not alone. As we age, the fluid that lubricates our joints thickens overnight. If you start moving too quickly without warming up, you can damage cartilage, worsen inflammation, or even trigger joint pain that lasts all day. But here's the good news: you can prevent this in less than 2 minutes. Right after your circulation warm-up, do this 90-second joint routine. Sit on the edge of your bed and rotate your ankles 10 times in each direction. Gently rotate your knees in circles. Stand, hold onto a chair, and slowly twist your torso left and right. Lean from side to side. Roll your shoulders back and forward again. I call this oil for your joints. These simple moves lubricate your joints, increase flexibility, and protect your independence. Remember, mobility is freedom. The more you protect it now, the more active and independent you'll stay in your 70s and 80s. Step 5. Sharpen your mind with 1 minute of mental clarity. Your body isn't the only thing that needs a morning reset, your brain does too. If you feel mentally foggy in the mornings or worry about memory loss, this step is for you. Neuroscientists have discovered that a simple morning mental exercise can strengthen something called cognitive reserve, your brain's ability to stay sharp and adapt as you age. Here's how it works. Before you check your phone, turn on the TV, or even talk to anyone, sit quietly, close your eyes, and mentally replay yesterday in reverse order. Ask yourself, what did I eat for dinner? Who did I talk to? What color was the sky yesterday afternoon? What emotions did I feel? This 1-minute practice wakes up your memory, sharpens focus, and builds mental resilience. People who do this daily remain sharper, more present, and more independent, even into their 80s. The Shaolin secret to aging strong. These 5 movement, protein, mobility, and mental clarity take just 5 minutes. But they can change everything about how you age. You see, the world often tells us that growing older means slowing down, losing strength, and accepting decline. But that's not true. I've worked with thousands of patients over the past 25 years, and I can tell you this: you have more control over how you age than you think. Tomorrow morning, you have a choice. You can rush through your morning, grab coffee, skip breakfast, and spend another day feeling tired, stiff, and scattered. Or you can take 5 quiet, intentional minutes to protect your heart, your muscles, your joints, and your mind. Start small. Start with just one habit. Maybe tomorrow you drink that glass of water with lemon. Maybe next week you add the 1-minute circulation warm-up. Build gradually. Because these aren't just morning habits, they're a message to your body: I respect you. I'm taking care of you. And your body will thank you, not just tomorrow, but for years to come. So, my friend, tomorrow morning, before the world calls your name, take back those 5 minutes. Stand tall. Drink slowly. Move gently. Eat with intention. Remember with gratitude. You're not just here to survive life after 50, you're here to thrive. And it all starts in the first 5 minutes of your day. This is Dr. Marcus Wells, and this is the Shaolin way to stay healthy after 50. Before you go, take action today. If you found this helpful, don't just listen, do it. Try one of these 5 steps tomorrow morning. Pick the easiest one. Make it yours. And if you notice even the smallest change, a little more energy, less stiffness, a clearer mind, come back here and let us know. Leave a comment below and tell me, which of these 5 habits are you starting with tomorrow morning? And if you're serious about staying healthy, strong, and sharp after 50, subscribe to Healthy After 50 and turn on notifications. Every week, I share practical, science-based tips to help you live longer, move better, and feel younger, without fads, fear, or false promises. This is Dr. Marcus Wells. Here's to your health, your strength, and your future. Stay strong, stay smart, and I'll see you in the next video. Men over 60, never eat these 3 vegetables, they could be hurting your testosterone. If you are a man over 60, you have likely been advised by doctors, nutritionists, or health magazines to eat more vegetables to protect your heart, maintain a healthy weight, and support overall well-being. While this advice sounds reasonable, it is not the full story. Vegetables are essential for good health, but not all vegetables are equally beneficial for aging men, especially when it comes to testosterone production and prostate health. The truth is that some vegetables, despite being labeled heart-healthy or superfoods, can quietly sabotage your hormonal balance. They may lower your testosterone levels, increase estrogen activity, and worsen inflammation, which directly affects your energy levels, libido, and sexual performance. For men over 60, who are already experiencing natural hormonal decline, the wrong dietary choices can accelerate these age-related changes. In this Senior Vitality Guide, Dr. Marcus Wells, a urologist and men's health specialist with over 3 decades of clinical experience, explains why certain vegetables should be limited or avoided by men over 60 and which vegetables can actually help you restore your vitality naturally. Why men over 60 need to be selective about vegetables. After age 60, your body undergoes significant hormonal shifts. Testosterone levels naturally decline by about 1% per year after midlife, while estrogen levels can rise, especially if you carry extra abdominal fat or consume foods that mimic estrogen in the body. This imbalance affects energy levels. Low testosterone and increased estrogen contribute to constant fatigue. Stiffened arteries reduce blood flow to vital organs, including the penis. Chronic inflammation and hormonal changes may worsen prostate enlargement, leading to urinary problems. Sexual vitality, reduced libido, weaker erections, and loss of confidence are common consequences. Unfortunately, the standard "eat more vegetables" advice does not account for how specific plant compounds can influence male hormones. Certain vegetables are rich in estrogen-like substances, inflammatory fats, or mineral-binding compounds that can make these age-related problems worse. The hidden danger in healthy vegetables. Men often proudly report eating large salads, green smoothies, or plant-based substitutes in an effort to stay healthy. However, as Dr. Wells emphasizes, the type and preparation of these vegetables matter just as much as the quantity. Some seemingly healthy plant-based foods can mimic estrogen activity in the male body, promote chronic inflammation, damaging blood vessels, block the absorption of critical minerals like zinc, essential for testosterone production. For men in their 60s, 70s, and beyond, the impact can be dramatic. Low energy, decreased libido, poor circulation, and declining confidence. 3 common vegetables that may lower testosterone. Dr. Wells identifies 3 vegetables and plant-based foods that are commonly included in healthy diets but can negatively impact men's hormonal health if consumed in the wrong amounts or forms. Soy products, tofu, soy milk, and processed snacks with soy protein contain phytoestrogens, plant compounds that mimic estrogen. In aging men, this can accelerate the natural testosterone decline and reduce sexual vitality. Processed corn products, corn oil, corn syrup, and corn-based margarine are high in omega-6 fatty acids, which promote inflammation and reduce nitric oxide production, impairing blood flow. Raw spinach, in excess, large quantities of raw spinach are high in oxalates, which bind to zinc and prevent absorption. Zinc is crucial for testosterone production and prostate health. These vegetables are not inherently bad, but their impact depends on how often and in what form you consume them. You can restore vitality naturally. Avoiding or modifying these 3 foods is the first step. The next step is to intentionally add vegetables that support male hormones, circulation, and prostate health. Wells' top recommendations for men over 60, as they enhance nitric oxide production, balance estrogen, and protect testosterone from conversion into inactive forms. With the right dietary approach, you can improve energy, restore confidence, and protect your prostate health, naturally, without relying on pills or hormone replacement therapy. Soy has been marketed as a healthier alternative to red meat, especially for heart health. Tofu, soy milk, and edamame often appear on lists of heart-friendly and cholesterol-lowering foods. But what many men over 60 don't realize is that soy can have unintended hormonal consequences that directly affect energy, sexual function, and overall vitality. Soy is rich in phytoestrogens, plant-derived compounds that closely mimic estrogen in the human body. While these compounds are harmless in small amounts for most people, they can interfere with a man's natural hormonal balance, especially later in life. As men age, testosterone production naturally declines. This decline is part of the normal aging process, but when additional estrogen-like substances enter the body through diet, it pushes the balance even further toward estrogen dominance. Phytoestrogens can bind to estrogen receptors, signaling the body to produce less testosterone. Testosterone is essential for muscle mass and energy production. Lower levels leave many men feeling chronically tired and weaker. Testosterone drives sexual desire and performance. Men with elevated estrogen often report waning erections, decreased sensitivity, and loss of confidence in intimate situations. An unfavorable estrogen to testosterone ratio encourages fat accumulation, especially around the midsection, which further suppresses testosterone by increasing aromatase activity, the enzyme that converts testosterone into estrogen. Even if you don't drink soy milk or eat tofu, soy often sneaks into the diet through processed and packaged foods, protein bars and shakes, meal replacement powders, processed sauces and salad dressings, packaged healthy snacks, many plant-based meat substitutes. Soy is inexpensive and used widely in the food industry as a filler or protein booster, so men often consume far more of it than they realize. Men over 60 should aim to limit or completely avoid soy-based products, especially if they are already experiencing symptoms of low testosterone, fatigue, or reduced sexual performance. Wild-caught salmon and fatty fish, rich in omega-3s that reduce inflammation and support vascular health. Pasture-raised poultry, a lean, clean source of protein without added hormones. Grass-fed beef, provides zinc and creatine, both critical for testosterone production and muscle maintenance. Organic eggs, contain healthy fats, choline, and essential amino acids that support hormone production. If you're buying packaged foods, always read labels carefully. Look for ingredients like soy protein isolate, soy lecithin, or soybean oil, and choose alternatives without them. Processed corn and corn oils, the hidden inflammation trigger for men over 60. When it comes to maintaining energy, circulation, and testosterone levels after 60, inflammation is one of your greatest enemies. And one of the biggest dietary contributors to chronic inflammation in older men isn't sugar or even red meat, it's processed corn and corn oils. Let's be clear, fresh corn on the cob, especially when eaten occasionally in its natural state, is not the problem. The real issue is the industrialized corn products that have infiltrated nearly every processed food in the modern American diet. Corn oil, commonly labeled as vegetable oil on ingredient lists. Corn syrup and high fructose corn syrup. Corn starch and other corn-based fillers in packaged foods. These products are cheap, heavily processed, and widely used in salad dressings, baked goods, fried foods, margarine, and even so-called health snacks. Why processed corn products are so harmful for men over 60? The problem lies in their very high omega-6 fatty acid content. While omega-6 fats are not inherently bad, consuming them in excess, especially when your omega-3 intake is too low, throws off the critical omega-6 to omega-3 balance in your body. For optimal health, humans need roughly a 1, but the typical American diet today averages 15:1 or even 20:1, and processed corn products are a major reason for this imbalance. This skewed ratio drives chronic low-grade inflammation, which slowly damages your body over time. For men over 60, the consequences can be serious. Damage to arterial wall. Inflammation irritates the endothelium, the delicate lining of your arteries. Healthy arteries produce nitric oxide, which relaxes and widens blood vessels for optimal circulation. When inflammation damages the endothelium, nitric oxide levels drop. Stiffened blood vessels, with reduced nitric oxide and persistent inflammation, arteries become less flexible, making it harder for blood to flow freely. Compromised blood flow to vital organs, including the penis. Poor circulation contributes to erectile dysfunction, lower energy, and even cognitive decline. Chronic inflammation is also associated with enlarged prostate, joint pain, fatigue, and faster aging, issues that become more pronounced after 60. Action plan for better hormonal and vascular health. If you want to protect your testosterone, circulation, and vitality, eliminating processed corn products is one of the simplest yet most powerful dietary changes you can make. What to avoid? Foods fried in vegetable oil, which often contains corn oil. Packaged snacks, chips, and baked goods. Margarine and processed spreads. Any food with corn syrup or high fructose corn syrup on the label. What to eat instead? Focus on increasing your omega-3 intake to counterbalance years of omega-6 overload. Include foods like fatty fish, sardines, mackerel, wild-caught salmon, nuts and seeds, walnuts, flaxseed, chia seeds. High-quality fish oil or krill oil supplements. Replacing corn-based oils with extra virgin olive oil or avocado oil for cooking is also an excellent choice for men over 60 who want to reduce inflammation and support heart and prostate health. The bottom line: for men striving to maintain strong circulation, healthy testosterone levels, and overall vitality well into their 60s and beyond, processed corn and corn oils are silent saboteurs. By removing them from your daily diet and increasing your omega-3 intake, you can dramatically reduce systemic inflammation, protect your arteries, and restore better blood flow, vital for both heart health and sexual performance. Raw spinach in excess, the hidden zinc blocker. Spinach has earned its reputation as one of the healthiest vegetables, packed with magnesium, iron, and antioxidants that support heart health and overall vitality. However, for men over 60 who rely on large amounts of raw spinach, especially in daily green smoothies, there's an overlooked downside. Raw spinach contains high levels of oxalates, naturally occurring compounds that bind to minerals in your digestive tract. When oxalates attach to minerals such as zinc, calcium, or magnesium, these nutrients pass through your system instead of being absorbed. For younger individuals, this might not pose a significant issue, but for older men, the consequences can be substantial. Zinc, in particular, is critical for testosterone production, prostate health, and sexual function. Even if you're eating zinc-rich foods like shellfish, beef, or pumpkin seeds, excessive raw spinach can block its absorption, leaving you with suboptimal levels. Why zinc matters so much after 60. Supports testosterone production. Zinc is a cofactor for enzymes that stimulate testosterone synthesis. Low zinc levels directly correlate with reduced testosterone output, which can lead to fatigue, loss of muscle mass, and diminished libido. Protects prostate health. Zinc accumulates in high concentrations in the prostate gland, where it helps regulate cell growth and inflammation. Chronic zinc deficiency has been linked to enlarged prostate and prostate dysfunction. Enhances immune and sexual health. Zinc plays a role in sperm production, wound healing, and immune defense, all crucial for maintaining vitality as you age. How to eat spinach without losing its benefits. You don't need to eliminate spinach altogether. It remains a nutrient powerhouse when prepared correctly. The key is how you cook it. Lightly steam or sauté spinach. Just a few minutes of heat dramatically lowers its oxalate content, allowing zinc and other minerals to remain available for absorption. Pair with zinc-rich foods. A spinach and egg scramble or sautéed spinach with grass-fed beef or oysters can boost mineral intake. Limit raw spinach. Swap daily raw spinach blends for cooked spinach dishes several times a week. By making this small change, many men notice gradual improvements in energy, mood, and sexual health as zinc levels normalize. The 3 testosterone-boosting vegetables men over 60 should be eating. Now that you know how to handle spinach properly, let's focus on 3 vegetables that actively support testosterone production, circulation, and overall vitality. Beets, the natural circulation enhancer. Beets are among the best natural sources of dietary nitrates, which your body converts into nitric oxide. NO relaxes and widens blood vessels, improving circulation and oxygen delivery. Better circulation means more nutrients and oxygen reaching muscles, the heart, and sexual organs. For men over 60 struggling with low energy, cold extremities, or erectile challenges, beets can be a game changer. Best way to eat beets. Fresh, raw grated beets in salads. Lightly roasted or steamed beets to preserve nitrates. Avoid pickled or canned beets. Heat and brining reduce nitrate content and add excess sodium. 2. Broccoli, the hormone balancer. Broccoli is a nutritional powerhouse, especially for men concerned about hormone balance. It's rich in sulforaphane, a compound that supports liver detoxification, reduces inflammation, and helps the body metabolize and eliminate excess estrogen. As men age, testosterone naturally declines, and estrogen tends to rise, a hormonal shift that contributes to belly fat, prostate issues, and lower libido. Broccoli helps restore a healthier testosterone to estrogen ratio. Best way to eat broccoli. Steam lightly for 3 to 4 minutes to preserve sulforaphane. Eat raw with a healthy dip like hummus or guacamole. Avoid microwaving or overcooking. It destroys sulforaphane's potency. White button mushrooms contain natural aromatase inhibitors. Aromatase is the enzyme that converts testosterone into estrogen, and its activity increases with age and abdominal fat. By blocking aromatase, mushrooms help preserve the free, active testosterone you already produce. More free testosterone translates into stronger muscles, sharper mental focus, higher libido, and improved mood, all essential for aging well. Best way to eat mushrooms. Sauté lightly with olive oil and garlic a few times per week. Add to omelets, soups, or stir-fries. Combine with zinc-rich foods to enhance overall hormonal support. Bonus tip, don't overlook boron, the forgotten mineral for testosterone support. When it comes to men's health, zinc and magnesium usually dominate the conversation. But there's another powerful nutrient that often gets ignored, boron. For men over 60 who want to maintain strength, energy, and sexual vitality, boron can make a noticeable difference. Why boron matters for men over 60. Boron plays a unique role in regulating testosterone availability. It works by lowering levels of sex hormone-binding globulin, a protein in your blood that binds to testosterone and makes it inactive. Think of SHBG as a lockbox that stores testosterone, keeping it out of reach for your muscles, brain, and reproductive system. Even if your total testosterone levels look normal on paper, high SHBG can leave you feeling tired, mentally foggy, and with a lower sex drive because very little testosterone is actually available to your tissues. By reducing SHBG, boron helps increase free testosterone, which is the active form your body uses to build muscle, maintain energy, support mental clarity, and fuel a healthy libido. Top boron-rich foods for senior men. Men over 60 don't need expensive supplements to get enough boron. Simple, everyday foods can do the job. A nutrient-dense superfood that supports hormone balance and provides healthy fats for heart and prostate health. A concentrated source of boron that is easy to add to breakfast or yogurt. Naturally sweet, rich in boron and minerals, and perfect as an afternoon snack for quick energy. Known for supporting bone health, prunes also deliver a solid dose of boron, helping older men maintain strength and vitality. Easy ways to add boron to your diet. Sprinkle a handful of raisins or chopped dates over your morning oatmeal. Add sliced avocado to your eggs or salads for lunch. Snack on prunes or dates in the afternoon instead of processed sweets. These small, consistent dietary habits can help optimize your hormone balance, keeping more testosterone free and active where your body needs it most. Boron might not be as famous as zinc or magnesium, but for men over 60, it can be the missing link to better energy, stronger bones, improved mental focus, and a healthier sex drive. Reclaiming your strength, energy, and confidence after 60. If you are a man over 60, aging does not have to mean losing your strength, your drive, or your masculinity. Too many men are unknowingly sabotaging their health with so-called healthy food choices. They are doing what they've been told for years, replacing red meat with soy, swapping butter for corn-based margarine, loading up on raw spinach smoothies, and yet they feel more tired, weaker, and less like themselves with every passing year. The truth is simple but powerful: the wrong foods, even healthy ones, can quietly disrupt your hormones, stiffen your arteries, and rob you of the energy and vitality that make you feel alive. But the good news is just as simple: your body can bounce back quickly when you feed it the right way. Start by removing the hidden saboteurs. Cut out soy, which floods your body with estrogen-like compounds at a time when you need every bit of testosterone you can hold on to. Avoid processed corn oils and corn syrup, which fuel chronic inflammation and restrict blood flow where it matters most. And if you're drinking daily green smoothies, rethink that habit. Large amounts of raw spinach can bind to zinc, leaving you without the very mineral your prostate and testosterone depend on. And build your meals around vegetables that work with your body, not against it. Beets improve circulation by increasing nitric oxide, opening your blood vessels and restoring strong, healthy blood flow. Broccoli helps detox excess estrogen, supporting the testosterone to estrogen balance that keeps you lean, sharp, and energetic. White button mushrooms protect your existing testosterone by blocking aromatase, the enzyme that steals testosterone and turns it into estrogen as you age. These are not gimmicks. There are no pills, powders, or quick fixes involved. Just smart, science-backed food choices that directly influence your hormones, your circulation, and your confidence. The changes can happen faster than you think. Many of my patients notice stronger morning energy, improved focus, and better performance in just a few weeks. Here's the truth every man over 60 needs to hear: you are not losing your masculinity because you're getting older. You are losing it because no one taught you how to eat for a man's body after 60. But you can change that starting today. Every bite you take is either feeding your vitality or slowly draining it. Make the right choice. Ditch the foods that weaken you and embrace the ones that rebuild you. Your strength, your clarity, and yes, your confidence can return. Aging doesn't have to mean slowing down. With the right foods on your plate, you can stay strong, capable, and fully alive, at 60, 70, and well beyond. Because getting older is inevitable, but losing your manhood is not. What really happens to your body when you stop having sex after 70? The truth every senior in America should know. Have you ever stopped to think about what truly happens to your body when sexual activity slows down, or even stops completely, after the age of 70? It's a question many older adults hesitate to ask, but for seniors across America, the answer is far more important than you might imagine. Sexual health after 70 is not just about pleasure or maintaining intimacy with a partner. It's a critical part of your overall health, affecting hormones, heart health, brain function, immune defense, and even the emotional bonds that keep life meaningful and fulfilling. When sex becomes less frequent, a chain of subtle but powerful changes can begin to take hold, changes that can influence how you feel physically, mentally, and emotionally. For many seniors, these shifts aren't immediately obvious. You might notice feeling more tired than usual, experiencing mood swings, catching colds more often, or even feeling less connected to your partner. What many older adults don't realize is that these changes are often linked to decreased sexual activity. In this article, we'll explore 5 important ways your health and well-being can change when sex slows down after 70, and what you can do to stay vibrant, healthy, and emotionally connected as you age. Whether you're married, dating, or single, understanding this connection can help you make better choices for your health and happiness. Your hormone levels drop faster after 70, and why it matters for seniors. As we age, hormone levels naturally decline, but for many Americans over 70, the absence of regular sexual activity can accelerate that decline in ways that directly impact health, energy, and quality of life. Why testosterone matters for seniors. Testosterone is often labeled the male hormone, but it is essential for both men and women in their later years. In men, it helps maintain muscle mass and physical strength, critical for mobility and preventing falls, reducing the risk of fractures and osteoporosis. Energy and vitality, combating age-related fatigue, cognitive sharpness, supporting memory and focus. For women, healthy testosterone levels are equally important. Low testosterone in older women can contribute to reduced muscle tone, low energy, and decreased mental clarity, making everyday activities more challenging. The role of estrogen in older women. Estrogen plays a crucial role in women's health after 70, far beyond reproductive function. It helps maintain skin elasticity and hydration, contributing to a youthful appearance and comfort. Bones, protecting against age-related bone loss, keeping arteries flexible and reducing heart-related risks. Mood and cognitive function, helping stabilize emotions and support memory. When sexual activity slows or stops, estrogen levels may decline faster, leaving many older women more prone to mood swings, irritability, and mental fog. Sexual activity as a natural hormone booster. For seniors, sexual activity acts like a natural hormone regulator. Intimacy triggers the body to release and balance hormones, helping maintain higher, healthier levels of testosterone and estrogen. Without that stimulation, age-related symptoms, such as muscle loss, fatigue, depression, and memory problems, can appear earlier and feel more intense. Robert's story. Robert, a 73-year-old retired engineer from Ohio, experienced this firsthand. After losing interest in sex following his wife's passing, he started feeling constantly tired and mentally foggy. Concerned, he visited his doctor, who discovered that his testosterone levels were unusually low for his age. With proper medical guidance, Robert adopted a hormone-friendly lifestyle. He started walking daily, added strength training exercises, focused on a protein-rich diet, and discussed hormone replacement options with his doctor. Within months, his energy improved, his mood stabilized, and his mental clarity returned. What seniors can do to support hormone health. Sex isn't the only way to maintain hormone balance after 70, but it's an important piece of the puzzle. If sexual activity has slowed, you can still protect your hormones. Staying physically active, strength training, yoga, or even brisk walking can stimulate hormone production. Meditation and relaxation techniques reduce cortisol, which interferes with testosterone and estrogen. Eating a nutrient-rich diet, healthy fats, lean protein, and zinc-rich foods support hormone health. Talking to your doctor, regular blood tests can help monitor hormone levels and discuss safe options, including lifestyle changes or hormone replacement therapy when appropriate. The key takeaway for Americans over 70. Sexual health isn't just about intimacy or pleasure, it's a powerful signal to your body to stay strong, energetic, and mentally sharp well into your golden years. Whether through physical intimacy, exercise, or other lifestyle changes, keeping your hormone levels balanced after 70 can dramatically improve how you feel every single day. Your heart loses a natural work. Why intimacy matters for seniors' heart health. When most people think about heart health after 70, they focus on diet, walking, or medication. But few realize that regular sexual activity is one of the most natural and enjoyable cardiovascular workouts you can give your body. Sex after 70 is more than a source of closeness or pleasure. It's also a powerful way to keep your heart strong. Every intimate encounter gently challenges your cardiovascular system in the same way light aerobic exercise does. How sex supports heart health after 70. During intimacy, your body experiences a unique combination of physical and chemical changes that directly benefit your cardiovascular system. Sexual activity temporarily raises your heart rate, giving it a mild but beneficial workout similar to brisk walking. Improved blood vessels dilate, promoting better circulation and oxygen delivery to vital organs. Lower blood pressure over regular sexual activity has been linked to healthier blood pressure regulation. Stronger, more flexible sexual activity stimulates the release of nitric oxide, a compound that helps keep your arteries open and elastic, reducing strain on your heart. This natural cardiovascular boost is especially valuable for seniors because it improves circulation and helps maintain overall energy levels. What happens when sexual activity stops? When sex becomes infrequent or stops entirely, your body loses this heart-friendly stimulation. Over time, that can lead to noticeable changes, poorer circulation and slower wound healing, higher fatigue levels and decreased stamina, increased blood pressure or difficulty controlling it, more frequent erectile dysfunction in men due to restricted blood flow, vaginal dryness and discomfort in women, also linked to reduced circulation. A real-life example. Take Joan, a 76-year-old retired schoolteacher. After her husband passed away, she gradually became less active and intimacy disappeared from her life. Within months, her energy dropped and her blood pressure rose. Her doctor explained that the decline in physical activity, including the loss of sexual activity, was partly to blame. Joan joined a gentle exercise class and started socializing more, which improved her heart health and mood. While she didn't return to sexual activity right away, staying physically and socially active helped her regain energy and confidence. What you can do if sex isn't part of your life. If you're no longer sexually active, there are still ways to give your heart similar benefits. Daily walking or light aerobic exercise to stimulate circulation. Gentle stretching or yoga to improve flexibility and blood flow. Social engagement and emotional connection to reduce stress, which is critical for heart health. However, don't underestimate the unique combination of physical and emotional benefits that intimacy provides. For those who are comfortable and able, sexual activity remains one of the most natural ways to support cardiovascular health after 70. Even non-sexual forms of affection, such as hugging, kissing, or simply holding hands, can release feel-good hormones, lower stress levels, and contribute to overall heart wellness. The bottom line: for seniors in America, where heart disease remains a leading health concern, maintaining intimacy can be a simple yet powerful tool for staying healthy. Whether through sex or other heart-healthy habits, keeping your cardiovascular system active is key to feeling energetic, reducing health risks, and enjoying life to its fullest. Your immune system. Why sexual activity matters for seniors in America. Many older adults are surprised to learn how strongly sexual activity supports the immune system. It's not just about intimacy or pleasure. It's about giving your body a natural boost to stay healthier as you age. During sexual activity, your body releases powerful hormones and chemicals, including oxytocin, dopamine, and endorphins. These aren't just feel-good chemicals. They actively reduce stress, lower inflammation, and stimulate your immune response. In fact, research shows that people who have regular sex tend to have higher levels of immunoglobulin A, an essential antibody that helps fight respiratory infections, colds, and even certain digestive issues. For seniors, this immune-boosting effect can be especially valuable. As we age, our immune system naturally becomes less efficient, making us more vulnerable to infections, slower recovery times, and lingering fatigue after illness. Sexual activity acts as a natural defense mechanism, helping your body respond more effectively to viruses and bacteria. What happens when sexual activity declines after 70? When intimacy slows down or stops altogether, you may notice more frequent colds or respiratory infections. Your immune system loses some of its natural defenses, making you more likely to get sick. Longer recovery times after illness, cuts, bruises, and even seasonal flu may take longer to heal. Lowered resilience and energy. You might feel tired more often, even if you're eating well and getting enough rest. This doesn't mean sex is the only factor in immune health, but it's an often overlooked piece of the puzzle for older adults. A real-life Walter's story. Walter, a 79-year-old retired accountant from Ohio, noticed he was catching colds every other month after he and his wife stopped being intimate. His doctor explained that age-related immune decline, combined with higher stress levels and reduced physical connection, was likely making him more susceptible to illness. Walter decided to take action. He focused on improving his sleep routine, adding moderate daily exercise, rekindling physical and emotional closeness with his wife, through hugging, holding hands, and eventually becoming sexually active again. Within a few months, Walter reported fewer colds and felt stronger and more energetic overall. His experience highlights how important connection, both emotional and physical, can be for your health. Intimacy beyond sex. What seniors can do. You don't have to engage in frequent or vigorous sexual activity to see benefits. Even non-sexual touch, such as hugging, cuddling, or holding hands, can help lower stress hormones and stimulate immune function. For Americans over 70 looking to strengthen their immune system naturally, stay physically active. Walking, stretching, and light resistance training improve circulation and help immune cells work better. Eat nutrient-rich foods. Include vegetables, fruits, lean protein, and omega-3 fatty acids to support overall immunity. Get quality sleep. Deep rest allows your body to repair and fight infections. Nurture emotional closeness. Physical affection and social interaction release oxytocin, which has been linked to stronger immune responses. Why this matters for seniors in America. Older adults in the U.S. face higher risks of chronic illnesses and infections, especially during flu season and in colder climates. While vaccines, healthy eating, and exercise are essential, maintaining some level of physical intimacy adds another layer of protection. The takeaway is clear: whether through sex or simple affectionate touch, staying connected to others can keep your immune system strong, reduce your chances of getting sick, and help you recover faster. How a decline in sexual activity after 70 can affect your mood and memory. Sex isn't just a physical act, it's one of the most powerful ways your body supports emotional balance and brain health. For many Americans over 70, a decrease in sexual activity brings unexpected changes in how they feel, think, and interact with others. Why does sexual activity impact mental health and cognitive function? When you're intimate with a partner, your brain releases a natural mix of feel-good chemicals. Dopamine, the reward hormone that boosts motivation and pleasure. Serotonin, crucial for regulating mood and reducing anxiety. Oxytocin, sometimes called the bonding hormone, which increases feelings of connection and trust. Regular sexual activity also stimulates areas of the brain involved in memory, attention, and problem-solving. This stimulation promotes neuroplasticity, your brain's ability to form new connections, which is essential for staying mentally sharp. When intimacy slows down or stops, you lose this natural brain workout, which can lead to more frequent mood swings, anxiety, or even depression. Slower thinking, forgetfulness, and memory lapses. Lower motivation to socialize or engage in stimulating activities. Margaret's story. Margaret, a 75-year-old retired nurse from Ohio, noticed she was becoming more forgetful and withdrawn after losing interest in sex following health challenges. Social gatherings felt exhausting, and her mood dipped into sadness more often. Her doctor explained that the reduced release of these mood-regulating hormones might be contributing to her symptoms. Instead of forcing herself back into a traditional sexual routine, Margaret focused on new forms of intimacy, gentle physical touch, cuddling with her partner, and spending more time in shared activities like gardening and cooking together. Within months, she reported better focus, improved memory, and a noticeable lift in her mood. What this means for seniors in America. The good news is, you don't need to maintain a high level of sexual activity to protect your brain and emotional health. Even non-sexual forms of closeness, such as hugging, holding hands, or spending quality time with a loved one, can trigger similar brain-boosting effects. Simple steps like regularly hugging or cuddling with your partner, staying socially active with friends and family, engaging in mentally stimulating hobbies like reading, puzzles, or learning new skills, practicing stress-reducing techniques like meditation or deep breathing, can help protect your mood and memory as you age. The takeaway. Sex after 70 isn't just about desire or physical pleasure, it's an important part of maintaining mental clarity, emotional stability, and overall happiness. Whether through intimacy, physical touch, or meaningful social interaction, staying connected to others helps keep your brain active and your spirits high. Emotional bonds can fade, and how to keep them strong after 70. Sex after 70 is far more than a physical act. It plays a powerful role in maintaining emotional closeness and relationship satisfaction. For many American seniors, intimacy is one of the strongest ways to feel connected, valued, and emotionally secure. When sexual activity slows down or stops completely, couples often experience a quiet but significant shift in their relationship. Emotional distance does not happen overnight. It builds slowly when physical affection fades. Without those small but meaningful moments of closeness, holding hands, kissing, cuddling, or even casual touches, partners may begin to feel less connected. This can lead to loneliness, more frequent misunderstandings, and sometimes even resentment, even in marriages that have lasted decades. The science behind this is clear. Physical intimacy stimulates oxytocin, often called the bonding hormone. Oxytocin creates feelings of trust, empathy, and attachment. When physical closeness decreases, oxytocin levels drop, making it harder for couples to feel that same deep emotional connection. Over time, this can make a strong, loving partnership feel more like two people simply sharing the same space. Take Evelyn and George, a married couple from Florida in their late 70s. After George developed health problems that affected their sexual activity, Evelyn felt increasingly lonely, even though George was always physically present. They started to argue more and felt emotionally distant. With the help of a counselor, they began finding new ways to show affection, like regular hugs, hand-holding during walks, and open conversations about their feelings. Slowly, the emotional warmth returned, proving that intimacy can be rebuilt at any age. The good news is that emotional intimacy does not have to fade with age. Even if sexual activity changes or becomes less frequent, couples can keep their emotional bonds strong, making physical affection a daily habit. Gentle touches, hugs, or holding hands during everyday activities can help maintain closeness. Sharing meaningful activities, cooking together, taking evening walks, or enjoying hobbies as a team builds a sense of partnership and connection. Talking openly about feelings. Honest communication is one of the strongest tools for keeping emotional intimacy alive, especially when physical intimacy changes. Exploring new forms of intimacy. Couples can redefine what intimacy means to them. Sometimes a quiet conversation before bed or watching a favorite movie together can feel just as connecting as sex. Emotional connection is not just about romance. It is deeply tied to overall health and happiness. Studies show that seniors with strong emotional bonds have lower stress levels, better cognitive function, and even longer lifespans. If you feel emotional distance growing in your relationship, it's important to act early. Whether through counseling, trying new ways to express affection, or simply being intentional about spending quality time together, you can keep your relationship strong and fulfilling well into your 70s, 80s, and beyond. Remember, love and connection do not retire with age. With care, patience, and creativity, emotional intimacy can remain one of the most rewarding parts of life at any stage. The changes that come with less sexual activity after 70 reach far beyond the bedroom. For older adults, the effects touch almost every system in the body. Your hormone balance, cardiovascular health, immune strength, mental sharpness, and even emotional connection with loved ones are all deeply interconnected. When intimacy fades, hormone levels decline faster, the heart loses a natural cardiovascular workout, immune defenses weaken, and mood or memory can suffer. Relationships may also feel less warm or connected, leading to feelings of loneliness or isolation. For many seniors, these shifts can quietly reduce energy, resilience, and overall quality of life. But here's the encouraging part: you have more control than you might think. Intimacy does not have to mean the same thing it did at 30 or 40. It can take many forms, and every step you take to stay connected can improve your health and happiness. Gentle physical activity such as walking or stretching helps replace some of the cardiovascular benefits of sexual activity and boosts hormone balance naturally. Open communication with your partner or even close friends helps maintain emotional bonds and prevents feelings of isolation. Simple physical touch, holding hands, hugging, or cuddling, can trigger the release of oxytocin, often called the bonding hormone, which supports emotional and mental well-being. Exploring new ways to connect, whether through shared hobbies, light physical intimacy, or even massage, can help maintain that sense of closeness and vitality. Aging does not mean giving up on connection or pleasure. Growing older in America often comes with outdated stereotypes about slowing down or losing interest in intimacy. But research and real-life stories from seniors show the opposite. Maintaining physical and emotional intimacy, whatever form it takes, supports healthy aging, stronger relationships, and a more joyful life. Whether you are single, married, divorced, widowed, or somewhere in between, nurturing intimacy after 70 can help you feel more vibrant, with better energy levels and mental clarity, more resilient, with stronger immunity and stress resistance, more alive, with deeper emotional connection and renewed sense of purpose. The bottom line: sex and intimacy after 70 are not just about desire. They are a vital part of healthy aging. By staying informed, adapting to life's changes, and honoring your emotional and physical needs, you can continue to enjoy the benefits of connection well into your later years. It's never too late to take small, meaningful steps toward intimacy. Even if sex is no longer part of your routine, touch, communication, and emotional closeness can provide the same life-enhancing benefits, keeping you strong, healthy, and truly alive at every age. Over 60. 4 cheeses you should never touch and 4 you must eat daily. Senior health tips. 4 cheeses you should eat and 4 you should avoid after 60, science-backed guide for seniors. Did you know most seniors are eating cheese the wrong way? Did you know that more than 85% of Americans over 60 eat cheese at least twice a week? Cheese is one of the most loved foods in the country, and for good reason. It's delicious, versatile, and packed with nutrients. But here's the shocking truth: most every senior makes at least one critical mistake in the cheese aisle, and it could quietly be cutting years off their life. Scientific research shows that certain types of cheese can double your risk of heart attack and reduce your chances of reaching 80 by nearly 40%. The worst part? Most people have no idea which cheeses are harming them, because they look perfectly normal on store shelves. The good news is, the solution is surprisingly simple. By learning which cheeses to choose, and which to avoid, you can protect your heart, keep your bones strong, and even support better brain function as you age. What you'll learn today. In this guide, we're going to break down The 4 healthiest cheeses you should eat regularly after 60. The 4 cheeses you should never touch if you care about your heart, your memory, and your future health. The worst cheese on the list has been linked to an 80% higher risk of stroke, and chances are, you've already eaten it this week without thinking twice. Join the conversation. Before we dive into the list, I'd love to hear from you. Where are you watching from? How old are you? And what's your favorite cheese? Share your answer in the comments. We read every single one because your experience might inspire someone else to make healthier choices. And if you're serious about staying strong, active, and healthy well into your 70s, 80s, and beyond, make sure to subscribe and turn on notifications so you never miss a new science-backed tip. Let's begin. The 4 best cheeses for people over 60. These are not just tasty options, they're backed by research for supporting bone health, improving digestion, and even lowering your risk of age-related diseases. The 4 best cheeses for seniors over 60. 4. Aged Gouda, a natural bone and heart protector for Americans over 60. If you are over 60 and looking for a cheese that supports strong bones, a healthy heart, and better digestion, aged Gouda should be at the top of your list. Unlike young or mild cheeses, Gouda that has been aged for 18 months or longer goes through a transformation that makes it a true nutritional powerhouse. Why aged Gouda is ideal for seniors. As we age, our digestive systems often become less efficient at breaking down and absorbing nutrients. Aged Gouda solves that problem naturally. During the long aging process, the proteins in the cheese are broken down into small, easily digestible peptides. This makes it much gentler on the stomach and easier for older adults to absorb its valuable nutrients compared to fresh or processed cheeses. But the biggest reason to add aged Gouda to your diet is its high content of vitamin K2. This vitamin is rarely discussed in mainstream nutrition, but it is essential for anyone who wants to maintain heart health and strong bones as they age. The calcium traffic director. Calcium is crucial for bone health, but in many older adults, it ends up in the wrong place, inside the arteries instead of in the bones. Vitamin K2 acts like a traffic controller for calcium, moving it away from your arteries and into your bones where it belongs. Scientific studies from Japan have shown that people with higher vitamin K2 intake had 50% less arterial calcification and significantly stronger bones, reducing the risk of fractures and cardiovascular problems. Just 1 ounce of aged Gouda provides around 75 micrograms of vitamin K2, which is more than most Americans get in an entire week. Considering that low K2 levels are linked to osteoporosis and heart disease, this makes aged Gouda a powerful ally for seniors. More health benefits you should know. Rich in CLA, conjugated linoleic acid. CLA is a healthy fatty acid that research links to reduced belly fat, improved immune function, and even protection against certain types of cancer. Gut-friendly postbiotics. During aging, beneficial bacteria create natural compounds called postbiotics. These support a healthy gut microbiome, reduce inflammation, and may even improve mood and mental clarity by supporting the gut-brain connection. Aged Gouda is virtually lactose-free, making it safe for most people who are lactose intolerant. The best way to eat aged Gouda. For maximum health benefits and flavor, eat 1 to 1.5 ounces per day. Let it sit at room temperature before eating. This enhances flavor and makes its nutrients more bioavailable. Combine it with apple slices or whole grain crackers. The fiber in these foods helps your gut absorb Gouda's beneficial compounds and work synergistically with its natural postbiotics. Aged Gouda isn't just a delicious snack, it's a strategic food choice for Americans over 60 who want to protect their heart, strengthen their bones, and support healthy digestion. Adding it to your weekly diet can be one of the simplest ways to invest in long-term health. Parmigiano Reggiano, the king of cheeses, for a reason. If there's one cheese every American over 60 should consider adding to their diet, it's authentic Parmigiano Reggiano. Known as the king of cheeses, this Italian classic is far more than a flavorful topping for pasta. It is a nutrient-dense superfood that supports bone health, muscle maintenance, and even brain function as we age. Parmigiano Reggiano is not the pre-grated powder in green cans you find in most grocery stores. Authentic Parmigiano is crafted in Italy using traditional methods that have been perfected for nearly 900 years. The strict production process and long aging period give this cheese a nutritional profile that makes dietitians and researchers take notice. Why Parmigiano Reggiano is a nutritional powerhouse. High quality, easily digestible protein. 1 ounce of authentic Parmigiano Reggiano provides around 10 grams of protein, but what sets it apart is the digestibility. The cheese is aged for 24 to 36 months, during which its proteins are broken down into smaller peptides and free amino acids. This process makes the protein almost pre-digested, meaning your body absorbs it quickly and with minimal effort, an essential benefit for older adults, whose digestion tends to slow with age. Because it contains all 9 essential amino acids, Parmigiano Reggiano is considered a complete protein source, rivaling meat and eggs in quality. Seniors looking to maintain or rebuild muscle mass can benefit from adding it to their diet, especially if they struggle to consume large portions of meat. Bone-strengthening calcium with perfect absorption. Parmigiano Reggiano is one of the richest natural sources of calcium, providing 330 mg per ounce, more than a glass of milk. But unlike many dairy products or calcium supplements, this calcium is paired with the ideal balance of phosphorus and magnesium, which maximizes absorption. Italian researchers have found that the calcium in Parmigiano Reggiano has nearly 100% bioavailability compared to the 25 to 30% absorption rate of most calcium supplements. For seniors concerned about osteoporosis, adding this cheese to a daily diet can be a game-changer for maintaining bone density and reducing fracture risk. Mood and brain function support. Parmigiano Reggiano contains high levels of tyrosine, an amino acid your brain uses to make dopamine and norepinephrine. These neurotransmitters are crucial for mental clarity, motivation, and alertness, qualities that often decline with age. It also naturally contains compounds called casomorphins, peptides that have a calming effect on the nervous system. Some research suggests these compounds may help improve sleep quality and reduce mild anxiety, making Parmigiano a smart choice for seniors dealing with stress or age-related sleep disturbances. 4. Lactose-free and gut-friendly. The long aging process naturally removes almost all lactose, making Parmigiano Reggiano well tolerated by people with lactose intolerance. It also contains beneficial bacteria that survive the aging process, helping support gut health, a key factor in immunity and nutrient absorption as we get older. How to eat Parmigiano Reggiano for maximum benefits. The way you eat this cheese matters. Instead of grating it over pasta, follow the traditional Italian method. Break it into small chunks using a knife rather than grating. This preserves its crystalline texture and keeps its nutrient structure intact. Eat it after meals. Italians often enjoy a small piece as a digestive aid. The enzymes in aged Parmigiano can help your stomach break down other foods more efficiently. Pair it wisely. A few drops of aged balsamic vinegar or a handful of walnuts can enhance mineral absorption and add extra antioxidants. The bottom line for Americans over 60. Parmigiano Reggiano is more than just a cheese, it's a functional food that supports strong bones, better digestion, sharper focus, and improved mood. For seniors looking to maintain independence and vitality, swapping out processed cheeses for a small daily serving of this Italian classic could make a meaningful difference in long-term health. Grass-fed raw cheddar, the probiotic powerhouse every senior should eat. If you are over 60, grass-fed raw cheddar deserves a place in your refrigerator. Unlike the heavily processed cheeses most Americans buy, this properly aged cheese from grass-fed cows is nutrient-dense, anti-inflammatory, and gut-friendly, making it an excellent choice for heart, bone, and brain health. What sets grass-fed raw cheddar apart is that it's made from raw milk and aged for at least 60 days. This aging process not only eliminates harmful bacteria but also preserves live enzymes and probiotics that pasteurized cheeses simply don't have. These natural probiotics are essential for seniors because support digestion. Healthy gut bacteria help break down and absorb nutrients more efficiently, reducing bloating and digestive discomfort, which are common as we age. A healthy gut is the foundation of a strong immune system, helping you fight off infections more effectively. Improve mental health. Research on the gut-brain axis shows that probiotics may help reduce anxiety, improve mood, and support mental clarity, important benefits for maintaining cognitive health in later years. But probiotics are only part of the story. Grass-fed raw cheddar is also packed with vitamins and healthy fats that most Americans over 60 are missing. Vitamin A, retinol supports vision, skin health, and immune function, crucial for bone strength and protection against osteoporosis, especially in seniors who get little sun exposure. Vitamin E, a powerful antioxidant that protects cells from age-related damage. Vitamin K2 directs calcium away from your arteries and into your bones, reducing the risk of arterial calcification and fractures. CLA, conjugated linoleic acid, and omega-3s, anti-inflammatory fats that protect your heart and may help reduce body fat. Because it's made from the milk of grass-fed cows, raw cheddar has 5 times more CLA and significantly higher omega 3 levels than conventional cheddar. It's essentially a natural supplement for joint, heart, and brain health, without the pills. How to eat grass-fed raw cheddar for maximum benefit. Let it sit at room temperature for 20 to 30 minutes before eating. This preserves its enzymes and probiotics and improves flavor. Pair it with fermented vegetables such as sauerkraut or pickles. This combination creates a probiotic powerhouse that supports gut health and digestion. Stick to 1.5 to 2 ounces per serving. This amount provides all the health benefits without overloading on saturated fat. Why it matters for Americans over 60. As we age, our digestive efficiency declines, our bones lose density, and our immune system weakens. Choosing high-quality, probiotic-rich cheeses like grass-fed raw cheddar is a simple, delicious way to give your body the nutrients it needs to stay strong and healthy. Swiss Gruyere, the best cheese choice for Americans over 60. When it comes to choosing cheese for optimal health after 60, authentic Swiss Gruyere stands out as one of the smartest options you can put on your plate. Unlike many popular cheeses that can raise inflammation and stress the heart, Gruyere is naturally anti-inflammatory, heart-friendly, and packed with nutrients that directly support aging bodies. Why Swiss Gruyere is a nutritional powerhouse for seniors. 1. Supports heart and artery health. One of Gruyere's biggest benefits comes from propionic acid, a compound produced by the beneficial bacteria used in its fermentation process. Clinical research links propionic acid to lower LDL cholesterol levels, improved arterial flexibility, which helps maintain healthy blood flow, reduced cancer risk, particularly in the colon, due to its ability to support a healthy gut environment. For Americans worried about cardiovascular disease, the leading cause of death after 60, choosing a cheese that actively supports heart health is a game-changer. Boosts the body's natural defense against aging. Gruyere is one of the richest dietary sources of glutathione precursors, compounds your body uses to produce glutathione, often called the master antioxidant. Why does this matter? Glutathione protects your cells from oxidative stress, which accelerates aging, weakens the immune system, and contributes to memory decline. After 60, natural glutathione production drops significantly, making foods that boost it essential for staying healthy and mentally sharp. The specific amino acids in Gruyere, including cysteine and glycine, are key building blocks for glutathione synthesis, giving it an advantage over other protein sources like meat or eggs. Helps maintain muscle mass after 60. Muscle loss, or sarcopenia, is a major issue for older Americans, often leading to weakness, slower metabolism, and a higher risk of falls. Swiss studies have shown that seniors who regularly consume Gruyere maintain muscle mass better than those who rely on other proteins. The reason is its unique protein structure. Gruyere's 12-plus-month aging process breaks proteins into easily absorbed peptides, requiring less digestive effort. This predigested protein helps build and repair muscle tissue without straining the gut. If you're over 60 and struggle to get enough high-quality protein without digestive discomfort, Gruyere is an ideal choice. Naturally lowers blood pressure. Gruyere contains special compounds called lactopeptides, which have been shown to naturally lower blood pressure by improving blood vessel function. This makes it a rare cheese that can be part of a heart-healthy, hypertension-friendly diet, as long as it's eaten in moderation. How to eat Swiss Gruyere for maximum health benefits. The way you eat Gruyere can influence how well your body absorbs its nutrients. Melt it gently into soups, omelets, or warm vegetables. Avoid boiling or overheating, as high heat can damage sensitive nutrients and beneficial peptides. Pair with whole grain bread or crackers. Whole grains provide magnesium and fiber, which help your body absorb Gruyere's B vitamins and minerals more effectively. Stick to about 1 to 1.5 ounces per serving. Gruyere is nutrient-dense, so a small amount goes a long way. For the best results, look for authentic Swiss Gruyere made from grass-fed cows. The traditional alpine grazing diet boosts its content of omega-3 fatty acids and fat-soluble vitamins like A and K2, both essential for heart and bone health after 60. The bottom line: if you're over 60 and want to protect your heart, maintain muscle, and slow down the effects of aging, Swiss Gruyere is one of the best cheeses you can choose. Unlike processed or high-sodium cheeses, it provides anti-inflammatory benefits, antioxidant support, and high-quality protein, all in a delicious, easy-to-digest package. Adding just a small serving to your weekly meals can help you stay stronger, more energetic, and healthier as you age. The 4 cheeses to avoid after 60. 4. Processed cheese slices, a heart attack in plastic wrap. If you grew up with grilled cheese sandwiches or quick lunchbox snacks, chances are you've eaten processed cheese slices more times than you can count. But if you're over 60, this is one food you need to think twice about before tossing into your cart. Those convenient, individually wrapped slices are far from real cheese. In fact, they typically contain less than 50% actual dairy, with the rest made up of sodium phosphates, emulsifiers, preservatives, and artificial colors. These additives might make the cheese melt perfectly and last for months, but they come at a serious cost to your health. The sodium content alone is alarming. Just 2 slices can pack over 600 milligrams of sodium, which is more than a quarter of your daily recommended limit. And this isn't just table salt. It's mostly sodium phosphate, a form of sodium that research links to accelerated aging, kidney damage, and increased cardiovascular risk. Seniors are especially vulnerable because kidney function naturally declines with age, making it harder to process excess sodium and phosphorus. The emulsifiers used to give processed cheese its smooth texture, such as polysorbate 80 and carboxymethylcellulose, can disrupt your gut microbiome. Studies show these additives may increase intestinal permeability, often called leaky gut, which triggers chronic inflammation. Inflammation is a major driver of heart disease, diabetes, and cognitive decline, 3 of the biggest health concerns for older Americans. Processed cheese slices also often contain artificial colors like yellow 5 and yellow 6. While legal in the United States, these dyes have been linked to allergic reactions and may contribute to hyperactivity and other neurological effects in sensitive individuals. Preservatives such as sorbic acid and natamycin extend shelf life but can interfere with beneficial gut bacteria, further compromising your digestive and immune health. And don't be fooled by the labels claiming these slices are a good source of calcium and protein. The ultra-processed nature of the product means the calcium and protein are less bioavailable, meaning your body struggles to absorb and use them effectively. Even more concerning, processed cheese slices can legally contain small amounts of trans fats due to labeling loopholes. Anything under 0.5 grams per serving can be rounded down to 0, so eating multiple slices can quietly add up to dangerous levels. Trans fats are strongly associated with higher bad cholesterol, lower good cholesterol, and an increased risk of heart attack. For Americans over 60, the combination of excess sodium, harmful additives, inflammatory fats, and poor nutrient quality makes processed cheese slices one of the worst choices in the dairy aisle. They may be cheap and convenient, but the long-term cost to your heart, kidneys, and overall health is far too high. If you love a good melted cheese sandwich, switch to a thin slice of grass-fed cheddar or Swiss Gruyere. Both melt beautifully, offer real nutrients, and support heart and bone health rather than harm them. 3. Cheese spreads in jars, the hidden chemical cocktail you should never eat. If you are over 60 and still keeping jarred cheese spreads in your pantry, it's time to reconsider. Shelf-stable cheese spreads are not real cheese. They are a processed chemical cocktail designed for long shelf life, not for your health. Unlike natural cheeses, which are aged traditionally, these spreads are heated, emulsified, and filled with additives to keep them smooth and spreadable for months or even years without refrigeration. This processing destroys almost all natural nutrients and replaces them with harmful ingredients that can quietly sabotage your health. Loaded with harmful fats. Many jarred cheese spreads still contain partially hydrogenated oils, which are artificial trans fats. Even if the label says 0 grams of trans fat, U.S. regulations allow up to 0.5 grams per serving to be rounded down to 0. Most people eat more than 1 serving at a time, meaning you could be consuming significant amounts without even realizing it. Trans fats are directly linked to higher LDL cholesterol, lower HDL cholesterol, and increased plaque buildup in arteries, a deadly combination for anyone concerned about heart disease or stroke. The American Heart Association has repeatedly warned that there is no safe level of trans fat intake. Even spreads advertised as trans fat-free often contain intraesterified fats, which research suggests may disrupt metabolism and increase insulin resistance, raising your risk for type 2 diabetes. A sodium bomb that spikes blood pressure. Cheese spreads are notoriously high in sodium, often exceeding 500 milligrams in just 2 tablespoons. And let's be honest, no one stops at 2 tablespoons. Excess sodium from processed sources raise blood pressure, increasing your risk of heart attack and stroke. Cause water retention, leading to swelling and extra stress on your heart and kidneys. Worsen symptoms of heart failure or kidney disease, which are already common in older adults. Unlike natural cheeses, where sodium occurs naturally with other beneficial minerals, the sodium in cheese spreads mostly comes from sodium phosphates and artificial flavor enhancers, which are harder on your cardiovascular system. MSG and hidden flavor enhancers. Most cheese spreads contain monosodium glutamate, or similar glutamate-based additives labeled as yeast extract or natural flavoring. While some people tolerate MSG well, others experience headaches, dizziness, and heart palpitation. Emerging research also suggests that high levels of glutamate may overstimulate certain brain cells, which could be a concern for seniors dealing with cognitive decline or neurological condition. Hormone-disrupting chemicals from packaging. The most concerning issue is phthalates. Industrial chemicals used to soften plastics. These chemicals can leach from the plastic jar or the inner lining of the lid into the spread itself. Phthalates are known endocrine disruptors, meaning they can interfere with hormone balance, particularly testosterone and estrogen levels. For older men, this may worsen low testosterone, muscle loss, and abdominal fat gain. For women, phthalates have been linked to bone density loss and increased risk of metabolic disorders. The long-term health risks. Regular consumption of Jared cheese spreads has been associated with obesity, from unhealthy fats and high-calorie density. Type 2 diabetes, from insulin resistance triggered by artificial fats. Heart disease and stroke, from trans fats, sodium phosphates, and arterial inflammation. Hormonal imbalances, from phthalates and other chemicals. In other words, what seems like a convenient snack can silently push you toward the very conditions you're trying to avoid after 60. The bottom line. If you want to protect your heart, maintain healthy blood sugar levels, and avoid unnecessary exposure to hormone-disrupting chemicals, skip cheese spreads in jars entirely. Instead, choose naturally aged cheeses like Parmesan, Gruyere, or raw cheddar. These not only taste better but also offer real nutritional benefits that support your health as you age. Shredded cheese, the hidden gut disruptor you're probably eating every week. Pre-shredded cheese may seem like a convenient time saver, but for adults over 50, especially those focused on heart health, digestion, and longevity, it can quietly sabotage your gut health and nutrient intake. The problem starts with what manufacturers add to keep those cheese shreds from clumping together. Most pre-shredded cheeses are coated with cellulose, essentially powdered wood pulp, along with antifungal agents like natamycin. While these ingredients are approved by the FDA, they come with health concerns that most consumers don't realize. Cellulose is marketed as a harmless plant fiber, but it's completely indigestible. That means your body can't break it down or extract any nutrients from it. For seniors with sensitive stomachs or digestive conditions like IBS, regular consumption of cellulose-coated cheese can lead to bloating, gas, and irritation. Worse, cellulose forms a thin coating on each shred of cheese, which interferes with proper melting and nutrient absorption. The calcium, proteins, and healthy fats you think you're getting from cheese may not be fully absorbed because of this barrier. A safe antifungal with a hidden cost. Natamycin is an antifungal preservative that keeps shredded cheese from developing mold during its long shelf life. While considered safe in small amounts, natamycin is technically an antibiotic. Over time, consuming antibiotic-based preservatives can disrupt the balance of your gut microbiome, reducing beneficial bacteria that are essential for digestion, immune function, and even mood regulation. For older adults, a disrupted gut microbiome can mean weaker immunity, poorer nutrient absorption, and higher inflammation levels, which are all linked to age-related diseases. Accelerated nutrient loss. Pre-shredded cheese also loses nutrients faster than block cheese. Once shredded, the increased surface area exposes the cheese to oxygen and light, speeding up oxidation of fats and destruction of vitamins. By the time it reaches your plate, much of its original nutritional value, particularly vitamins A, E, and K2, may already be gone. Additionally, pre-shredded cheese often contains higher levels of histamines due to longer processing and storage. For people sensitive to histamines, this can trigger headaches, skin irritation, digestive upset, or even anxiety. Higher risk of contamination. Because pre-shredded cheese goes through extra processing steps, shredding, coating, and extended packaging, it carries a greater risk of bacterial contamination. There have been multiple recalls in the U.S. due to Listeria and E. coli outbreaks in shredded cheese products, which can be dangerous for older adults with weakened immune systems. The bottom line. Pre-shredded cheese may save you a few minutes in the kitchen, but it comes with real health risks, especially if you're over 50. The gut-disrupting additives, nutrient loss, and contamination risk make it a poor choice for anyone serious about maintaining good health, strong digestion, and a robust immune system as they age. Always buy block cheese and shred it yourself. Not only will you avoid unnecessary additives, but you'll also get fresher flavor, better nutrient retention, and improved gut health. Blue cheese, a hidden stroke risk you can't ignore. Blue cheese may look sophisticated on a salad or cheese board, but for seniors, especially those with heart or blood pressure concerns, it can be one of the most dangerous choices in the dairy aisle. The same mold that gives blue cheese its strong flavor also makes it a nutritional risk that most people underestimate. Why blue cheese can be harmful after 60. Extremely high tyramine levels. Blue cheese is loaded with tyramine, a naturally occurring compound formed when proteins break down during aging. In healthy individuals, small amounts may not be a problem, but in older adults, especially those on blood pressure or antidepressant medications, tyramine can trigger sudden and severe spikes in blood pressure. In fact, medical studies link high tyramine foods to hypertensive crises in people taking MAO inhibitors, a common medication for depression and Parkinson's disease. A trigger for migraines and allergic reactions. Blue cheese contains significantly higher levels of histamines than most other cheeses, sometimes up to 10 times more. Histamines can trigger migraines, skin rashes, hives, digestive discomfort, and insomnia in sensitive individuals. Since histamine intolerance often worsens with age, many seniors may experience symptoms without realizing that blue cheese is the culprit. Pro-inflammatory saturated fats. The fat in blue cheese is especially high in palmitic acid, a type of saturated fat linked to higher levels of inflammation and an increased risk of cardiovascular disease. For seniors already dealing with high cholesterol, diabetes, or heart disease, regular consumption of blue cheese may further raise the risk of heart attack or stroke. Potential exposure to mold toxins, mycotoxins. The distinctive blue veins in this cheese come from Penicillium roqueforti, a mold that produces small amounts of mycotoxins. While generally considered safe in small quantities, long-term and frequent consumption may lead to accumulation in the body. Some researchers believe that even low-level exposure could worsen chronic inflammation, joint pain, and brain fog in sensitive individuals. Who should avoid blue cheese? Seniors with high blood pressure or heart disease, because of the risk of sudden blood pressure spikes and increased inflammation. Anyone with histamine intolerance. Common symptoms include headaches, flushing, itching, digestive upset, and insomnia. People taking MAO inhibitors or certain antidepressants, combining these medications with high tyramine foods can be dangerous. The bottom line. Blue cheese may seem like a harmless indulgence, but for Americans over 60, it can quietly increase the risk of migraines, high blood pressure, and even stroke. If you enjoy cheese, consider safer options like aged Gouda, Parmigiano Reggiano, or Swiss Gruyere, which provide beneficial nutrients without the hidden dangers of blue cheese. Why your cheese choices matter more than you think. When you are standing in front of the cheese section at the grocery store, it may feel like every option is the same, just different flavors. But the truth is far more serious. The type of cheese you choose can directly affect how you age, how strong your bones remain, how sharp your memory stays, and even how long you live. For Americans over 60, this is not just about taste or comfort food. It is about taking control of your future health with every bite you eat. The simple switch that protects your heart, bones, and brain. If you are serious about staying active and independent in your 60s, 70s, and beyond, the solution is surprisingly simple. Eat more of the good cheese, aged Gouda, authentic Parmigiano Reggiano, grass-fed raw cheddar, and Swiss Gruyere. These cheeses are rich in nutrients like vitamin K2, CLA, and bioavailable calcium, which protect your arteries, strengthen your bones, and support muscle and brain function. Eliminate the bad processed cheese slices, Jared cheese spreads, pre-shredded cheese, and blue cheese. These options are loaded with sodium, artificial additives, and harmful fats that can quietly raise your risk of heart disease, high blood pressure, and even cognitive decline. Why this matters for every American over 60. Heart disease, osteoporosis, and age-related cognitive decline are some of the leading health concerns for seniors in the United States. Research shows that the right dairy choices can lower your risk of arterial calcification, improve bone density, and even help maintain healthy brain function as you age. This is not about giving up cheese altogether. It is about making smart swaps that deliver maximum nutrition without silently harming your health. One small change in your weekly grocery shopping could mean the difference between staying strong and independent, or facing years of unnecessary health struggles. Your turn, share your experience. We want to hear from you. What's your favorite cheese, and have you ever noticed changes in how you feel after eating certain types? Maybe you felt less bloated after switching to aged cheeses, or perhaps processed slices made your blood pressure spike. Your story could help another American over 60 make a better choice, protect their health, and enjoy more good years ahead. Share your thoughts in the comments below. We read every single one. And if you care about living longer, staying stronger, and aging well, keep following for more science-backed health tips designed especially for seniors in America. As a prostate doctor, I warn seniors, this habit may be enlarging your prostate. If you're a man over 60, what you're about to read could mean the difference between enjoying peaceful, uninterrupted nights, or spending years struggling with urinary discomfort, frequent bathroom trips, and restless sleep. Every day, millions of American men in their 60s, 70s, and even 80s are making simple but harmful mistakes that quietly damage their prostate health. The problem is, these habits often feel harmless or even normal with age. Most men don't think twice about them. As a prostate specialist, I see it all the time. Men walk into my clinic frustrated, tired, and worried because they're waking up 3, 4, sometimes 5 times a night to urinate. Many of them feel embarrassed or believe it's just part of getting older. But that's not entirely true. Aging does affect the prostate, yes, but daily habits play a much bigger role than most men realize. The truth is, small actions you take, or don't take, every single day can determine whether your prostate stays healthy or becomes enlarged, swollen, and inflamed. And here's the most important, it's never too late to change course. I've treated men in their late 70s and early 80s who reversed many of their urinary symptoms simply by adjusting these habits. So, if you're tired of sleepless nights, slow or difficult urination, that constant feeling that your bladder isn't empty, or the embarrassment of having to plan your day around bathroom trips, keep reading. Understanding these mistakes could spare you from years of discomfort, medication, or even surgery. In the next section, I'll break down the 10 daily habits that may be silently enlarging your prostate, and more importantly, I'll show you what to do instead to keep your prostate healthy, even as you age. Your prostate health is in your hands more than you think. And for men over 60, every small change counts. Chronic stress is far more dangerous than most realize, especially for your prostate. It is one of the most underestimated risk factors for prostate enlargement and urinary problems. When you're under constant stress, your body releases high levels of cortisol, the primary stress hormone. Elevated cortisol disrupts almost every system in your body. It tightens the muscles in your pelvic region, reducing blood flow to the prostate and bladder. This restriction of circulation means your prostate receives fewer nutrients and less oxygen, slowing its ability to repair itself. Over time, this leads to irritation, inflammation, and gradual gland enlargement. Stress also wreaks havoc on your hormones. Men under long-term stress often experience a drop in testosterone and an increase in estrogen, which can directly contribute to prostate growth. On top of that, stress weakens your immune system, making you more vulnerable to infections in the urinary tract and prostate. One of the clearest signs of stress-related prostate issues is urinary urgency, rushing to the bathroom frequently, especially at night. Many men attribute this solely to aging, but stress-induced inflammation is often a major factor. Tightened pelvic muscles also make it harder to completely empty the bladder, leaving urine behind and increasing the risk of further irritation. The good news is that you can reverse much of this damage by actively managing stress. Even small daily habits can calm your nervous system and protect your prostate. Deep breathing and relaxation. Just 5 to 10 minutes of slow, controlled breathing lowers cortisol levels and relaxes pelvic muscles. Light stretching and gentle exercise, yoga, tai chi, or simple morning stretches improve circulation and reduce tension in the pelvic area. Quiet time or meditation. Taking even 10 minutes of silence daily resets your nervous system and lowers inflammation markers. Laughter and social connection, spending time with friends or family, sharing stories, or simply laughing releases feel-good hormones that counteract cortisol. Consistent, quality sleep, restorative sleep regulates hormone balance, allowing your prostate to heal overnight. Aim for 7 to 8 hours of uninterrupted rest. A short walk in fresh air or exposure to natural sunlight boosts mood, supports hormone health, and relieves tension. Stress management isn't just about feeling better. It's a medical necessity if you want to reduce urinary symptoms and keep your prostate healthy as you age. The sooner you begin, the faster your body, and your prostate, can recover. It's a major risk factor for prostate problems, especially for men over 60. Abdominal fat is biologically active, meaning it doesn't just sit there, it releases inflammatory chemicals called cytokines that circulate through your body, including the prostate. This constant, low-grade inflammation irritates prostate tissue, making it more likely to swell and enlarge over time. Belly fat also disrupts your hormonal balance. As abdominal fat accumulates, it converts testosterone into estrogen, lowering your testosterone levels and increasing estrogen levels. This imbalance is directly linked to prostate growth and can also affect sexual function, leading to reduced libido and erection difficulties. Additionally, excess belly fat puts physical pressure on your bladder and surrounding pelvic organs, making urinary symptoms, like frequent nighttime trips to the bathroom or difficulty emptying the bladder, much worse. Research consistently shows that men with larger waistlines are significantly more likely to experience benign prostatic hyperplasia, BPH, erectile dysfunction, and even more severe urinary retention issues. For older men, this combination of hormonal imbalance, inflammation, and pelvic pressure creates a perfect storm for prostate discomfort. So what's the solution? Start by setting a realistic goal. Aim for a waist circumference under 40 inches. You don't need extreme dieting or exhausting workouts. Instead, focus on slow, sustainable changes. Gentle exercise, daily walks, light stretching, or low-impact activities like swimming or cycling improve circulation, help burn fat, and reduce pelvic pressure. Even 20 to 30 minutes a day can make a noticeable difference. Portion control. Reducing portion sizes and avoiding second helpings is an easy way to cut calories without feeling deprived. Limit sugar and processed carbs. High-sugar foods and refined carbs spike insulin levels, encouraging more fat storage around the waist. Replacing them with whole grains, vegetables, and lean protein supports steady weight loss and better hormonal balance. Losing even 5 to 10 pounds can dramatically ease urinary symptoms and lower inflammation. Remember, your waistline isn't just about appearance. It's a key indicator of your prostate health. Taking steps to reduce belly fat can lead to fewer nighttime bathroom visits, improved sexual function, and better overall well-being as you age. Eating too much red meat. For many American men, a juicy steak or a burger feels like a well-deserved comfort food, but after 60, eating red meat too often can quietly take a toll on your prostate. Red meat, especially processed meats like bacon, sausage, and deli cuts, has been strongly linked to increased inflammation in the body. This isn't just about short-term discomfort. Chronic inflammation is one of the key factors that lead to prostate enlargement over time. One of the biggest concerns with processed red meats is the chemical additives, preservatives, and high levels of saturated fat they contain. These substances can disrupt hormonal balance, particularly by affecting testosterone and estrogen levels, both of which play a role in regulating prostate size. Additionally, processed meats tend to generate higher oxidative stress in the body, which damages cells and weakens the tissues surrounding the prostate. Another issue that becomes more relevant after 60 is digestion. As we age, our digestive system slows down, making it harder to break down heavy, fatty meats. This slower digestion can lead to bloating, weight gain, and added pressure in the pelvic area, which indirectly affects the prostate by increasing irritation and urinary discomfort. The solution isn't to completely give up red meat, but to enjoy it in moderation. Limit red meat consumption to once or twice a week, and when you do eat it, choose leaner cuts like sirloin or tenderloin instead of fatty steaks or processed varieties. Even better, replace some of those meat-heavy meals with healthier protein sources. Grilled fish, skinless chicken, beans, lentils, and other plant-based options not only provide essential nutrients but are also rich in fiber, which supports better digestion and helps reduce overall inflammation. Making this simple shift in your diet won't just benefit your prostate, it will also improve heart health, maintain a healthy weight, and give you more energy as you age. Over time, these changes can mean fewer urinary symptoms, less nighttime discomfort, and a stronger, healthier prostate well into your senior years. Skipping annual checkups. Far too many men wait until symptoms become unbearable before visiting a doctor, and this delay can be costly, especially after age 60. Prostate enlargement, or benign prostatic hyperplasia, often develops gradually and without obvious warning signs. By the time urinary issues like frequent nighttime trips, weak urine flow, or bladder discomfort appear, the prostate may already be significantly enlarged. Regular checkups are your best defense. A yearly visit to your urologist or primary care physician allows for early detection of subtle changes that you might not notice on your own. 2 simple exams are essential. Digital rectal exam, DRE. Though quick and slightly uncomfortable, this manual exam helps the doctor feel the size, shape, and texture of your prostate, detecting lumps or irregularities that could indicate BPH or even early-stage prostate cancer. PSA test, prostate-specific antigen. This blood test measures PSA levels, which can rise due to inflammation, enlargement, or cancer. When monitored annually, your doctor can track changes over time and act early if levels begin to climb. Early detection often means early, less invasive solutions, simple lifestyle changes, dietary adjustments, or mild medications instead of stronger drugs or surgery. It can also prevent complications like urinary retention, infections, or kidney strain. Many men feel embarrassed discussing urinary or prostate issues, but doctors are trained to handle these concerns professionally and discreetly. Remember, prevention is always easier than treatment. If you are over 60, commit to at least one annual prostate health appointment and talk openly about any urinary changes, even if they seem minor. Taking this step now can save you from years of discomfort and protect your long-term health. Smoking or exposure to smoke, a hidden but serious threat to your prostate. If you are over 60, smoking, or even just being around smokers, can quietly do lasting damage to your prostate. Many men underestimate how harmful tobacco smoke really is, but the chemicals in cigarettes affect nearly every organ in the body, including the prostate. When you inhale cigarette smoke, toxic substances like nicotine and tar restrict blood flow and reduce oxygen delivery to delicate tissue. Poor circulation means your prostate doesn't get the nutrients and oxygen it needs to repair itself. Over time, this leads to chronic inflammation, which is one of the primary drivers of prostate enlargement. Inflammation also increases the risk of developing prostatitis, painful prostate inflammation, and can, in severe cases, raise the risk of prostate cancer. But the danger isn't limited to smokers themselves. Secondhand smoke, breathing in smoke from other people's cigarettes, has been shown to cause the same type of oxidative stress and tissue damage. For older men, whose bodies already repair more slowly with age, this constant exposure can speed up prostate problems significantly. The good news is that your body begins to heal quickly after you quit smoking. Within just a few weeks of quitting, blood circulation improves, inflammation decreases, and the prostate starts recovering from years of irritation. The longer you stay smoke-free, the lower your risk of future complications. If you have already quit smoking, you're on the right path, but it's still important to stay away from smoky environments. Regular exposure to secondhand smoke can undo much of the progress your body is making to heal itself. Choose smoke-free restaurants, avoid gatherings where people smoke indoors, and encourage family or friends who smoke to do it outside. For men who are still smoking, talk to your doctor about quitting strategies. Nicotine replacement therapies, prescription medications, or even natural approaches like mindfulness and breathing exercises can help you quit for good. At any age, it's worth making this change, not just for your lungs and heart, but for your prostate health as well. Holding in urine. Many men over 60 have developed the habit of holding it in, either because they are busy, don't want to interrupt an activity, or simply don't want to make another trip to the bathroom. But this habit can quietly cause serious damage to your prostate and urinary system. When you ignore the urge to urinate, your bladder stretches beyond its normal capacity. Since the prostate sits just below the bladder, this extra pressure directly affects it. Repeatedly forcing the bladder to hold urine for too long leads to irritation and swelling of prostate tissue. Over time, the muscles in both the bladder and prostate can weaken, making it harder to fully empty your bladder when you finally do go. Another hidden danger is stagnant urine. When urine sits too long in the bladder, it becomes a breeding ground for bacteria, increasing the risk of urinary tract infections and chronic inflammation. For men with an already sensitive or enlarged prostate, this trapped urine worsens symptoms like urgency, burning, and nighttime trips to the bathroom. The solution is simple but crucial. Listen to your body. Go to the bathroom as soon as you feel the urge, even if it's inconvenient. For men over 60, this one habit alone can prevent worsening urinary problems, reduce irritation, and protect prostate health for years to come. Eating spicy or processed food. Why it's hurting your prostate. Enjoying a spicy dish once in a while isn't a problem, but making hot sauces, chili peppers, or heavily seasoned meals a daily habit can slowly irritate your prostate without you even noticing. Spicy foods stimulate your body's inflammatory response. For men over 60, whose tissues are already more sensitive, this extra inflammation can lead to prostate swelling, urinary urgency, and discomfort over time. Processed foods are an even bigger problem. Items like chips, bacon, sausage, deli meats, frozen dinners, and fast food are packed with preservatives, artificial colorings, excess sodium, and unhealthy fats. These ingredients create a perfect storm for your prostate. Excess sodium makes your body retain fluid, putting added pressure on your bladder and prostate. Unhealthy fats, especially trans fats and saturated fats, disrupt hormone levels, including testosterone and estrogen, which directly influence prostate size and health. Chemical additives and preservatives can trigger low-grade, chronic inflammation throughout the body, making prostate tissue more reactive and swollen. Over time, this silent irritation worsens urinary symptoms, nighttime trips to the bathroom, difficulty starting or stopping urine flow, and that constant feeling that your bladder never fully empties. The good news? You don't have to give up flavorful meals to protect your prostate. Shift to an anti-inflammatory diet that supports hormonal balance and tissue repair. Focus on fresh vegetables and fruits, rich in antioxidants that fight inflammation. Fatty fish like salmon or sardines, packed with omega-3 fatty acids that protect prostate tissue. Nuts and seeds, provide healthy fats that help regulate hormone production. Herbs and mild spices, swap out hot sauces for turmeric, basil, oregano, or rosemary, which actually reduce inflammation. Think of every meal as a choice between fueling irritation or supporting healing. By cutting back on processed and overly spicy foods, you give your prostate the chance to calm down, shrink naturally, and function better. Caffeine is a natural stimulant and diuretic, which means it increases urine production and stimulates bladder activity. This can lead to more frequent trips to the bathroom throughout the day and night, disrupting your sleep and daily routine. Beyond just making you urinate more often, caffeine also causes the muscles of the bladder to contract more frequently and sometimes unpredictably. These involuntary contractions create a strong and sudden urge to urinate, sometimes leading to leakage or difficulty holding urine long enough to reach a bathroom. This urgency can be frustrating and embarrassing, affecting your quality of life. Additionally, caffeine has the effect of tightening the muscles around the bladder neck, the area that controls the flow of urine from the bladder. When these muscles contract excessively, it becomes harder to fully empty the bladder. Incomplete emptying means urine stays trapped in the bladder longer, creating pressure on the prostate gland, which sits just below the bladder. Over time, this added pressure can cause inflammation and swelling of the prostate, worsening symptoms like urinary frequency, urgency, and discomfort. It's important to note that the effect of caffeine varies from person to person. Some men can tolerate a morning cup of coffee with no issues, but problems usually arise when multiple caffeinated drinks, like additional coffee cups, sodas, or energy drinks, are consumed throughout the day. For men over 60, it's wise to limit caffeine intake to 1 cup early in the morning and avoid caffeine later in the day. If you find your urinary symptoms worsen with caffeine, consider replacing your afternoon or evening coffee with decaffeinated coffee, herbal tea, or simply water. These alternatives hydrate without irritating your bladder or prostate. Making this small change can reduce bladder spasms and nighttime trips to the bathroom, improving both prostate health and overall comfort. However, prolonged sitting can quietly harm your prostate health in several important ways. When you remain seated for extended stretches, you place continuous pressure on the pelvic area, where your prostate gland is located just beneath the bladder. This constant pressure restricts proper blood circulation to the pelvic region. Good blood flow is essential to keep tissues healthy and free from inflammation. When circulation slows down, it creates an environment where inflammation can develop and persist. Additionally, sitting too long weakens your pelvic floor muscles, the group of muscles that support your bladder and prostate function. Strong pelvic floor muscles are necessary to fully empty your bladder during urination. But when these muscles become weak from inactivity, urine tends to remain trapped in the bladder after you go, known as urinary retention. This leftover urine can irritate your prostate further and increase your risk of infections. The combination of pressure, reduced circulation, and weak muscles contributes to prostate enlargement and worsening urinary symptoms, including urgency, frequency, or difficulty starting and stopping your urine stream. To combat these effects, it's crucial to break up long periods of sitting. A simple strategy is to set a timer or reminder to stand up and move every 30 minutes. Getting a glass of water, or stretching your legs can improve blood flow and reduce pressure on your pelvic area. These small, frequent movements keep your pelvic muscles engaged, promote better bladder emptying, and help reduce inflammation. Incorporating light physical activity throughout your day isn't just good for your prostate. It supports overall health, including heart, joint, and mental well-being. So, resist the urge to stay seated for hours at a time. Your prostate, bladder, and body will thank you for the extra care. Not drinking enough water. Many men over 60 try to reduce nighttime trips to the bathroom by simply drinking less water, especially in the evening. While this might seem like a smart way to avoid interruptions during the night, it can actually make prostate and urinary problems worse in the long run. When you don't drink enough fluids, your urine becomes highly concentrated and acidic. This concentrated urine can irritate both your bladder and your prostate gland, which sits just below the bladder. Chronic dehydration doesn't just cause discomfort, it triggers inflammation in the prostate. Inflammation is one of the primary factors that contribute to the prostate enlarging over time, a condition known as benign prostatic hyperplasia. This enlargement leads to symptoms like frequent urination, difficulty starting or stopping the urine stream, and the feeling that your bladder never empties completely. On top of that, many men in their 60s and beyond take medications that can unintentionally increase the risk of dehydration. Diuretics, blood pressure medicines, and some other common prescriptions can cause your body to lose more water, making it even more important to maintain proper hydration. If you don't drink enough water, toxins start to build up in your urinary system, placing extra strain on your bladder and prostate. The solution is straightforward. Drink water consistently throughout the day in small amounts rather than large gulps at once. Your urine color is a good indicator of hydration. Ideally, it should be clear or a very light yellow. If it's dark yellow or amber, your body needs more fluids. Don't be afraid of water. It's your prostate's best natural defense against inflammation and enlargement. By keeping yourself well hydrated, you help flush out toxins, reduce irritation, and support the healthy function of your urinary system. Remember, it's not about drinking large amounts right before bed but maintaining steady hydration all day long. This approach helps minimize nighttime bathroom visits while protecting your prostate and bladder health. What you can do today to protect your prostate. They are effective, proven strategies that have the potential to dramatically improve your quality of life. By making even one of these changes, you can reduce uncomfortable symptoms like frequent nighttime trips to the bathroom, difficulty urinating, and the frustration of relying on medication. Start small. Choose just one habit to focus on this week. Maybe it's drinking more water throughout the day to keep your urinary tract healthy and reduce irritation. Or perhaps it's committing to getting up and moving for a few minutes every half hour to improve blood flow and relieve pressure on your prostate. You could also cut back on red meat and processed foods, opting instead for lean proteins and fresh vegetables that support hormone balance and reduce inflammation. Remember, improvements won't happen overnight, but consistency is key. Your body has a remarkable ability to heal itself, especially when given the right support. By making steady, manageable changes, you'll give your prostate the chance to recover and maintain its health naturally over time. It's important to know you're not alone in this. Millions of men over 60 face similar challenges, and many have successfully turned their health around by adopting healthier habits. No matter your age or current condition, it's never too late to take control. By prioritizing your prostate health today, you're investing in better sleep, more energy, and greater comfort for years to come. Take that first step, your prostate will thank you. 5 medical tests seniors over 70 should rethink what you really need and what to skip. 5 medical tests seniors in the US should think twice about after turning 70, scientific evidence you need to know. In the United States, older adults are constantly told that routine screenings and regular checkups are the key to staying healthy. It's a message deeply ingrained in American healthcare culture. The earlier, the better. Catching it early saves lives. Don't skip your annual screenings. But what if this well-meaning advice doesn't always apply, especially after age 70? Today, a growing number of physicians, public health experts, and peer-reviewed studies are challenging the one-size-fits-all approach to preventive testing in older adults. The data shows that for many healthy seniors, certain routine medical exams may no longer offer meaningful benefits, and in some cases, they can cause physical, emotional, and financial harm. The truth, more testing doesn't always mean better care. If you're over 70, or if you're helping care for aging parents or loved ones, it's time to ask a critical question. Are all these medical tests still necessary? The answer isn't always. In fact, continuing certain screenings past a certain age may result in false positives and unnecessary anxiety, invasive procedures and follow-up surgeries, over-medication and long-term side effects, rising out-of-pocket costs not always covered by Medicare, no measurable increase in lifespan or quality of life. That's why it's so important to separate truly essential screenings from those that may no longer serve a purpose, and could even backfire. In this science-backed guide, we break down 5 medical tests seniors in the US should carefully reconsider after age 70. If you're an older adult, or advocate for someone who is, this could help you avoid unnecessary procedures, save money, and protect your health. 1. Why full-body CT scans are risky for Americans over 70, what you need to know before booking one. Full-body CT scans are frequently marketed in the United States as premium preventive health checks, often included in executive physicals or elite health screening packages at private clinics. Many Americans see these scans as a way to catch serious health problems early and take control of their well-being. However, the reality is far more complicated and concerning. Full-body CT scans expose patients to very high doses of ionizing radiation, significantly more than standard X-rays. According to a 2023 study published in JAMA Internal Medicine, the cumulative radiation from CT scans may contribute to up to 5% of all cancers diagnosed annually in the U.S. This cancer risk is roughly equivalent to the risk from daily alcohol consumption, highlighting the serious long-term danger. Beyond the radiation risk, full-body CT scans frequently identify benign abnormalities such as harmless nodules, cysts, or calcifications, especially common in older adults. Unfortunately, these findings often trigger a chain reaction of unnecessary medical interventions, including further imaging tests, invasive biopsies, and even surgeries, all carrying their own risks of complications, costs, and emotional stress. For healthy seniors over 70 without symptoms, there is no scientific evidence that routine full-body CT scans improve survival rates or enhance quality of life. In fact, experts including the American College of Radiology strongly advise against the use of full-body CT scans as general screening tools in asymptomatic adults due to these risks. What should Americans do instead? If you're over 70 and concerned about your health, focus on proven strategies for healthy aging rather than high-risk screenings. Maintain a balanced diet rich in fruits, vegetables, and whole grains. Stay physically active with regular exercise tailored to your ability. Manage chronic conditions with your healthcare provider's guidance. Get age-appropriate screenings recommended by your doctor, such as mammograms, colon cancer screening, or heart health evaluations. Discuss any symptoms like unexplained weight loss, persistent pain, or bleeding with your physician for targeted diagnostic testing rather than broad, high-risk scans. Take control of your health wisely. Before scheduling a full-body CT scan, ask yourself, is this scan necessary based on my current symptoms or risk factors? Will the scan result change my treatment plan or improve my health outcomes? Am I aware of the radiation risks involved? If the answer is no or you're unsure, consider consulting a trusted healthcare professional for a personalized evaluation. Avoid unnecessary radiation exposure that could increase your cancer risk and lead to potentially harmful medical procedures. Your health is your most valuable asset. Protect it with smart decisions, not unnecessary tests. Colonoscopy after age 75. Why seniors should reconsider routine screening. Colonoscopy remains the gold standard for colorectal cancer screening in the United States, helping save thousands of lives each year by detecting precancerous polyps and early-stage cancer. However, for Americans aged 75 and older, the benefits of routine colonoscopy decline sharply, especially if previous screenings were normal. At this age, the potential harms and risks often outweigh the benefits, making it crucial to carefully evaluate whether this invasive procedure is right for you. Risks of colonoscopy in seniors over 75. Undergoing a colonoscopy after age 75 involves several serious considerations. The laxatives used to clean out your colon can cause dehydration and electrolyte imbalances, which can be particularly dangerous for older adults with underlying health issues. Sedation during the procedure increases the risk of postoperative cognitive decline, delirium, and prolonged recovery times in seniors. Seniors face an increased risk of complications such as bleeding, infection, and even colon perforation. These complications often require hospitalization and may lead to long-term health consequences. A landmark 2019 study analyzing over 1.3 million Medicare beneficiaries found that for every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved, while more than 20 patients experienced serious adverse events. This data highlights the delicate balance between potential life-saving benefits and real risks in elderly populations. What are safer alternatives to colonoscopy? If you are over 75 and have had regular normal colonoscopy results in the past, you may want to discuss alternative screening options with your healthcare provider. Fecal immunochemical test. This stool-based test is non-invasive, can be done comfortably at home, and does not require bowel prep or sedation. It detects hidden blood in the stool, a common early sign of colorectal cancer. Stool DNA testing, another at-home option that analyzes DNA markers in stool samples, offering high sensitivity for detecting cancer and precancerous lesions without the risks of invasive procedures. Talk to your doctor today. If you're an American senior over 75, don't agree to routine colonoscopy without fully understanding the risks and benefits. Make an informed decision by discussing your personal health history, previous screening results, and risk factors with your doctor. Ask about non-invasive screening tests like the FIT or stool DNA tests, which offer safer, effective alternatives for colorectal cancer detection in older adults. Prioritize your health and quality of life by choosing screening methods that fit your unique needs. Remember, your age, overall health, and screening history matter. Colonoscopy after 75 is not a one-size-fits-all solution. Stay informed, stay proactive, and partner with your healthcare provider to make the best choice for your longevity and well-being. While this test is commonly used to detect heart problems, many older adults in the U.S. without clear symptoms of heart disease may face more risks than benefits from this procedure. Cardiac stress tests without symptoms can do more harm than good. Research shows that in adults over 70 who don't have classic heart disease symptoms, like chest pain during exercise or shortness of breath, the false positive rate for stress tests can be as high as 40%. This means nearly half of these tests may incorrectly indicate a heart problem when there isn't one. These false positives often lead to follow-up procedures such as angiograms, stent placements, or even bypass surgeries. Unfortunately, studies confirm that these invasive interventions do not improve survival rates or quality of life in asymptomatic seniors. Worse yet, these procedures come with significant risks, including bleeding complications, kidney damage from contrast dyes, and extended hospital stays. For many seniors, these side effects can result in a decline in independence and overall health. Safer and smarter alternatives to stress testing for seniors. If you don't have obvious signs of heart disease, it's important to discuss safer, more effective diagnostic options with your doctor. Resting electrocardiogram, a quick, non-invasive test that measures your heart's electrical activity while at rest. Coronary calcium scan, a low-radiation CT scan that detects calcium buildup in your arteries, helping assess your risk of heart disease without invasive procedure. These tests have a lower risk of complications and often provide clearer information to guide your healthcare decisions. Take control of your heart health, ask the right questions. If you're a senior American concerned about your heart health, don't automatically agree to a cardiac stress test. Before proceeding, ask your healthcare provider. Do I have any clear symptoms of heart disease that justify this test? What are the risks associated with the cardiac stress test in my age group? Are there safer alternatives better suited for me? Your health is your most valuable asset. Make informed decisions by focusing on evidence-based medicine and personalized care. Remember, true heart disease prevention after 70 isn't about routine stress testing. It's about smart, individualized medical guidance and lifestyle choices. It's common for family members and seniors themselves to worry about early signs of dementia or Alzheimer's disease. Because of this, doctors often order brain MRI scans to check everything to catch problems early. However, the reality is more complex. Research published in Neurology Today in 2021 highlights that 97% of older adults who received brain MRIs due to mild cognitive complaints showed no treatable abnormalities. Most findings on these scans, such as white matter hyperintensities, small spots, or slight brain shrinkage, are actually normal age-related changes and do not mean dementia or any serious neurological condition. Unfortunately, these normal findings often cause unnecessary anxiety and lead to more invasive follow-up tests like lumbar punctures, spinal taps, expensive PET scans, or even brain biopsies. These procedures come with their own risks, including infection, bleeding, and increased stress. If you or a loved one in the U.S. over 70 are experiencing mild memory issues, here's what to do instead. Start with a simple cognitive screening test during your primary care visit. Tools like the Mini Mental State Exam or Montreal Cognitive Assessment provide reliable, low-risk ways to evaluate brain function. Focus on proven lifestyle strategies to support brain health, prioritize quality sleep, stay well hydrated, engage in regular physical exercise, and challenge your brain with puzzles, reading, or social activities. Talk openly with your healthcare provider about your symptoms and concerns. Ask if brain MRI is truly necessary or if monitoring over time with lifestyle adjustments is the safer, more effective route. Don't rush into expensive and potentially harmful imaging just because memory lapses worry you. Early detection is important, but so is avoiding unnecessary tests that don't improve your health and may even cause harm. Take control of your cognitive health today by choosing smarter, evidence-based steps. Contact your primary care physician to schedule a cognitive screening, and commit to lifestyle habits that help keep your mind sharp for years to come. 5. Why routine bone density scans after 70 may be doing more harm than good. In the United States, bone density tests are widely used to screen for osteoporosis, particularly among postmenopausal women and older adults. But here's what many Americans over 70 aren't being told: even in healthy seniors with no history of fractures or falls, these scans almost always show some degree of bone loss, not because of disease, but simply due to normal aging. This often leads to a troubling cycle. A scan shows osteopenia or mild osteoporosis. The patient is prescribed medications like bisphosphonates. The drugs trigger dangerous side effects, without significantly reducing fracture risk. According to a major study published in the Journal of the American Geriatric Society, treating age-related bone loss in women over 70 with prescription drugs had little to no impact on preventing future fractures. In fact, the side effects of these medications, including osteonecrosis of the jaw, esophageal damage, and atypical femur fractures, can be far more dangerous than the bone thinning itself. What doctors often don't mention: low bone density doesn't always mean high fracture risk. Bone quality, muscle strength, balance, and fall frequency matter just as much, if not more, than a scan result. Most fractures in older adults occur from falls, not from silently deteriorating bones. Many seniors are labeled as high risk and placed on medications for life, when no treatment was needed in the first place. A smarter, safer approach for older Americans. If you're over 70, haven't experienced fractures, and don't have a high fall risk, it's time to rethink routine DEXA scans. Rather than relying on a test that may do more harm than good, focus on natural, evidence-based strategies to strengthen your bones and prevent injury. Incorporate weight-bearing and resistance exercises, e.g., walking, yoga, light strength training. Get enough vitamin D and calcium through food and supplementation as needed. Practice balance and mobility training to reduce your fall risk. Stay physically active and maintain a healthy body weight. Before agreeing to a bone density scan, ask your doctor, will this change how we treat my health, or just lead to unnecessary medication? The bottom line for seniors: not every scan leads to better health, especially after 70. In many cases, routine DEXA scans in non-fragile older adults lead to overtreatment, fear, and unnecessary medication. If you're not actively falling or suffering fractures, there's a good chance you're better off focusing on lifestyle-based bone health strategies rather than pharmacological solutions. Talk to your doctor about whether this scan is truly needed, or whether it's just part of a one-size-fits-all approach that may no longer serve you. Why Americans over 70 should rethink routine medical screenings. Modern medicine has significantly improved life expectancy in the United States, but for older adults, particularly those aged 70 and above, more testing isn't always better medicine. In fact, overscreening can sometimes lead to unnecessary anxiety, risky procedures, and lower quality of life. That's why it's essential for American seniors, and their families, to shift from automatic checkups to individualized, evidence-based care. Before agreeing to any preventive test, ask your doctor, what exactly is this test screening for? Is there a real chance it will find something that can be treated effectively at my age? What are the potential harms of the test? Radiation, sedation, false positives, complication. If an abnormality is found, will the next steps improve my quality of life, or just lead to more testing and worry? Too often, older Americans are sent down a diagnostic rabbit hole. One test leads to another, followed by invasive treatments, even when the initial findings weren't dangerous to begin with. This approach not only inflates healthcare costs, it can also cause physical and emotional harm, especially when test results are ambiguous or misleading in older populations. It's time to put your health goals first. If you or someone you care about is over 70 and generally in good health, don't assume routine screenings are still necessary. Medical guidelines change with age, and what made sense in your 50s may no longer offer benefits in your 70s or 80s. Instead, talk to your primary care physician or geriatric specialist about your current health status and risk factors, the expected benefits versus risks of any proposed test, less invasive, safer alternatives to traditional screenings, your personal values and goals for aging. Personalized care, not a one-size-fits-all checklist, is the cornerstone of smart, safe aging. Stay informed. Stay in control. At a time when the healthcare system often prioritizes procedures over people, knowledge is your best defense. Making informed medical decisions doesn't mean ignoring your health, it means focusing on what truly matters to your well-being, independence, and peace of mind. If you're an American senior, or caring for one, subscribe to our free weekly newsletter for science-backed advice tailored to older adults, expert insights on when to say yes or no to testing, practical tips for navigating aging with clarity and confidence. Don't let outdated routines dictate your healthcare. Take control, ask questions, and choose a path that supports your values. not just your vitals. Over 50. Try this simple seed for natural retina support. Senior health tips. Healthy after 50. Are vision problems really inevitable after 50? For millions of Americans over 50, eyesight challenges feel like an unavoidable part of aging. Blurred vision, night blindness, difficulty reading fine print, and constant eye strain are often brushed off as just getting older. But modern research challenges this idea. Scientists now believe that some age-related vision decline may not be purely genetic or irreversible. Instead, it can be influenced by diet, inflammation levels, oxidative stress, and nutrient deficiencies, all factors that can be addressed with the right nutritional support. And here's the best part. You may already have one of the most powerful vision-supporting tools sitting right in your kitchen pantry. Why this matters for Americans over 50. Vision health is more than just clarity of sight, it's directly connected to quality of life, independence, and even emotional well-being. Age-related macular degeneration. This serious retinal condition impacts 1 in 10 Americans over 50, making it one of the most common causes of vision loss in seniors. A leading cause of blindness in adults, especially among people with type 2 diabetes, which is increasingly common after 50. Glaucoma, often called the silent thief of sight, this condition affects millions of Americans and can progress without early symptoms. And vision loss doesn't just affect reading or driving. Seniors with poor eyesight are at a higher risk of falls, fractures, depression, and loss of independence. Studies show that vision-related mobility problems often lead to reduced physical activity, which in turn impacts cardiovascular health, weight management, and mental wellness. What science is revealing. Emerging research shows that certain nutrients found in common seeds, such as sunflower, pumpkin, chia, flax, and others, can provide natural, food-based support for retinal and overall eye health. Here's why they matter. Antioxidants for retinal protection. The retina is one of the most metabolically active tissues in the body, which means it constantly uses oxygen and produces free radicals. Over time, oxidative stress damages retinal cells, contributing to conditions like AMD. Antioxidants such as vitamin E, lutein, and zeaxanthin, found in seeds like sunflower and chia, help neutralize these free radicals. Omega-3 fatty acids to reduce inflammation. Chronic, low-grade inflammation is increasingly recognized as a key driver of age-related eye problems. Seeds like chia, flax, and hemp are rich in plant-based omega-3s, which may help reduce inflammatory damage to both the retina and optic nerve. Zinc for visual function. Zinc plays a critical role in transporting vitamin A to the retina, which supports night vision and visual clarity. Pumpkin seeds are an excellent natural source of zinc, and studies show that seniors often have declining zinc levels due to reduced absorption with age. Improved circulation for eye tissues. Proper blood flow is essential for delivering oxygen and nutrients to the retina. Seeds such as black sesame and grape seeds contain compounds that may help support microcirculation, which is crucial for maintaining healthy retinal cells. What this means for you. If you're over 60, you don't have to simply accept vision decline as an inevitable part of aging. Adding a handful of nutrient-rich seeds to your daily diet may help protect your eyes naturally. While these foods aren't a cure or a replacement for professional eye care, they can be an easy, affordable, and science-backed way to support long-term vision health. For best result, be consistent,